are good to go when you guys are.
Well, good morning, everyone, and welcome to the Washington County Board of Commissioners work session for Tuesday, April 13th, 2021. This is Chair Catherine Harrington, and with us this morning are Commissioners Pam Treese, Jerry Willey, and Nafisa Fye. I anticipate that Commissioner Roy Rogers will be along shortly. So the first item on the agenda is board and leadership communication. Who would like to go first? Commissioner Treese, you're unmuted. Did you want to go?
Not really.
Okay.
I nominate Nafisa.
Yes, Commissioner. Good morning, Chair. Thank you. And today is the first day of Ramadan. So 30 days of not drinking and not eating from sunrise to sunset starts. It's going to be a challenging, I think, but the hours are not as long as it could get. So at least it's in April and rather than August or July. So that's exciting. And the why it changes is because we follow the lunar calendar, so it rotates. So sometimes it's 30 days and sometimes it's 31 days, but we fast 30 days. I think other than that, I don't really have a lot to communicate other than last week was really busy, and I'm close to having a staff assistant. We interviewed the final interviews last week, and was really exciting. And I listened in yesterday for the first time the WCCC as a listening attendee, and it was great to be part of that conversation.
Great. Commissioner Willey?
Well, I guess I could follow Commissioner Treese and say, I nominate Commissioner Treese, but no, I will go ahead. Play your silly game. Anyway, yeah, it was a busy week last week. I've got several things that I want to take a couple of extra minutes for. So first, I met with Kim Strelcham with the Right Brain Initiative last week. I hadn't been reintroduced to that organization for several years, and I just really like that group. It always, the one event that I went to several years ago when I was mayor was, it challenged me. As you all know, I'm very left brain logic centered, so anything I have to do on the creative side needs some help. So anyway, enjoyed getting caught back up on their initiative and what their plans are. Also was able to fill in for Chair Harrington for the Public Health Week announcement last week and show the appreciation that from the commission of how much we appreciated all of our folks in Health and Human Services, and certainly all the hard work they've been doing for the last 14 months, and wanted to show that appreciation. So thank you for giving me that opportunity to do that. It was a great event, and Marnie always does a great job with that. Anyway, also met with the Fair Board, and we were talking about, of course, the upcoming fair, if there is going to be one, and what that will look like. We decided to go one specific direction, but there's a lot of details yet, so I'm going to wait before I give you some more background on that. But we are going to be putting on a fair. It won't look exactly like the previous fairs, obviously, because of our limitations on attendance and other things. But so we are going to be, I'll give you more of that information when Leah has that firmed up a little bit. Obviously, working with the Northwest Act, we submitted our earmarks as well, transportation earmarks, to Congresswoman Bonamici, and that was an interesting process. City of Banks is working on has submitted on their project, which is working on the Banks-Vernonia trailhead, parking and all of that, increase the parking space available there. And there's just a number of things going on with that. Salmonberry Trail also has submitted a request for some funding to get started on this end of the trail as well. So lots of things going on there. And then one other thing is I've asked Rebecca to join me. Just a second, I gotta pull that up. For some proposed changes to our Veterans Day, Memorial Day and Veterans Day services, and to try and do a little bit more of an outreach to those folks. So I've asked Rebecca if she would join us. I see her there. So Rebecca, if you could fill the commission in with some of the things that we've been talking about and certainly the information that I've got. So go ahead, Rebecca.
Absolutely. Good morning, everyone. My internet's being a little spotty. Can you hear me?
Yes, we can, Rebecca.
Okay, sorry. It always picks the most opportune moments, doesn't it? Let me find my sheet. So I don't know if people have, let me get the sun glare out of my eyes here. Were you able to see the document that did you share that document, Commissioner Willie? Perfect.
Yes.
Great.
Yeah.
So we just wanted to give an update to Commissioner Willie as our and to the board as this is a project to kind of retool our outreach to new times and just make sure we can reach the new veterans. We found that the Veterans Day and Memorial Day holidays are super important and we want to continue to promote those, but for us to stage those events is a significant outlay of time, and we'd love to make sure we're reaching new veterans and really addressing some of the equity and barriers that we see for some of our veterans. So that's the intent. We'll still be participating in Memorial and Veterans Day events, but not necessarily promoting and being at the Memorial Gateway as we have in the past.
Yeah, I think the document there, I want to make sure that everybody did have that document. I see the chair does. Pam, were you shaking your head there? Okay, good. And Nafisa, we're good on this. Yeah, and I think the interesting thing is that because last year we had to have a virtual service there on Veterans Day, we did a video and the video received 200 views. And I thought that's significantly more people than we get to be in person in attendance. I think so. If we can find a blend in there, I certainly don't want to give up the services, and I really enjoy those. So, but at the same time, if we can increase our outreach significantly like this, then I'm all for that as well. So, if you have any questions, of course, please reach out to Rebecca and have some insight or questions on this. And yeah, we're gonna move ahead, and I'll certainly update you when I have more information. So thank you, Rebecca, for joining us this morning. And
have a great day.
If I could, I really
Sure.
appreciate the creativity and trying different things at different times. Being a child of a military family and a veteran, and my brother's a veteran as well, I have attended multiple Memorial Day and Veterans Day holiday events throughout Washington County, but mostly the majority of them of my attendance has been in Beaverton. And one quality that I have gotten from each of them, no matter where I've been, has been connection. And certainly growing up in a military environment, I always felt like I had this huge family and huge support network. And going to these events allowed me to appreciate history, even history during my lifetime, but also make that connection. And always having interesting speakers has been very helpful as well. So I applaud your continuing to try different avenues for connection. You just never know when someone may be quietly in need of a connection, and your efforts will really pay off. So thank you for trying different things at different times. There is no, the only wrong way is to not try, right? So good job.
Thank you, Chair Harrington. I'd just like to give credit really to Vicki Horan and her team for really developing this and coming up with this new plan. And our ABSAC members for really supporting the work. Thank you.
Terrific. Thanks for joining us, Rebecca.
Thank you very much, Rebecca. You bet. Okay, that's concludes my part. Thanks.
Thanks, Commissioner Willie. Commissioner Treese.
Thank you for your patience. I was looking for the agenda from my PAB meeting last week because I just wanted to make sure I got all the pieces there. The PAB meeting, we did approve the action plans for Washington County, Beaverton, and Hillsborough. So that's a good step in our process. The other thing that we spent quite a lot of time talking about was a program that is focused on shower trucks that will move throughout Washington County. And it was quite detailed and quite a lot of discussion on, how to do that effectively, what it costs and what all the different points to the plan were. So that was, it was a really lively discussion and a good discussion. Also, I'd just like to let everybody know that Mayor Lenahan has stepped down as chair of the PAB, and she is bringing another council member onto the PAB, and we will be electing a new chair. So just for your information, and that's it.
So commissioners, if you're interested, the roster of different projects that were part of that plan that Commissioner Treese just mentioned, there's a great presentation. They had a public hearing as required to do, and it really continues to demonstrate how we in government, federal, state, county, local, city levels work in partnership with area nonprofits and community-based organization to meet the needs of our community members. So if you're interested in that presentation, we can get that to you very easily. And on the shower trucks, that is to help with the our houseless community members throughout Washington County. And I really appreciate the creativity and intent that is going behind that to make it not only available, but available in a predictable way, so that folks in need can get the hygiene that we need them to have, particularly during this continued global pandemic. My goodness. So
there's one other thing to your comments, Chair, and that is in a predictable way and in a safe way. I mean, that's really an important factor for everybody. So it's not a new approach, but it's new to us. So it's a good thing. And if any of you would like to see more, but you have more of all of the different projects, I'd be happy to send that out.
great. Thank you, Commissioner Treese. So for me, last week, just a whole host of different meetings. Commissioner Treese and I participated in the North Bethany Community Service District for Roads meeting, and they have a good roster slate moving forward for this next budget year. State of the City of Tigard, Late Night with Tigard was last Wednesday night. That's always fun, and you can tune into that online as well. I met along with our CAO with the CAT team, that's the Center for Addictions Treatment and Triage. We went over the draft feasibility study and shoring that up to work it through a little bit more to get it in a good shape to come before the board. So stay tuned for that in the coming months. Had a great meeting with our LUT staff on the Basalt Creek Parkway project and helping them tune their presentation so that it will bring not only the new counselors of Tualatin along in a better fashion, but also to really talk about how we help new city councilors in the various cities who are responsible for the community planning for new urban areas, those new UGB expansion areas. And it takes, a good 20 years to get all of the infrastructure in place. So we need to do a better job of bringing them along, no matter how far along in that 20-year timeframe we may be. I had a couple of meetings with the various chairs of the state legislature Ways and Means Committee. They've got quite a job to try and weigh all the different asks for funding from the various committees with the different aspects of the state's portfolio. So they have a hard job in front of them. Yesterday was a full AOC day. The AOC Legislative Committee will be hosting a retreat likely in August. And for the next two meetings for the AOC steering committees, the steering committees that happen on Mondays, as well as the legislative committee and the board meeting. They're working to be able to host those meetings in person as well as virtually. The May meeting will be taking place in Hood River, and the June meeting will likely be hosted in Sun River. They had to try and find facilities that could handle up to 100 people and be mindful of where the different counties are in the risk categories. There was a show and tell speaker at the Ledge Committee yesterday, and that was the USDA Intergovernmental Affairs representative. And Commissioner Willie, I'll send you her contact information. She spoke about efforts to expand rural broadband as well. She also mentioned this goal, a new executive order from President Biden that's referred to as 30 by 30, conserving 30% of our lands and water by 2030 to maintain our ecosystem. And they're going to be having listening sessions to gather more information about what might be done at the local county levels in order to support that goal. Then I have a few very specific things from both the Ledge Committee as well as the Board of Directors. The Government and Revenue Committee is taking emergency management under their wing as well. Senate Bill 299, this is related to the Children's Service District. AOC has taken a position of opposing that. Under Natural Resources, they're working on House Bill 2520 that's currently at a -3 around solar siting on resource lands. And there's now a negotiated position to take that through rulemaking at LCDC to make it clear about rules for exceptions. There's also a new bill dealing with regional water planning. Representative Owens is working on this. It's a permissive bill to convene water forums, and it has a small price tag. This isn't a program that I think we have been involved with, but there are various counties that have found the opportunity of convening these forums and the small financial support from the state, rather meaningful for working through some key issues they have. In Transportation and Community Development, House Bill 2190 is -3. This is on community renewable energy. AOC's taken a position of support. The biggie is Senate Bill 213 relating to design professionals, and this affects us, all counties, particularly for road projects, where it transfers the liability from vendors to the counties. So that's a pretty key one. So if our government affairs team hasn't worked on that with our staff, particularly our legal team, then we need to hop to it. That's Senate Bill 213. And then there's another bill, Commissioner Willie, you may want to be mindful of. They're not going to act on this session, but they're looking to change the definition of a veteran at the state level. And it's being targeted for a 2022 session. And at AOC, they've the Ledge Committee adopted a policy definition that allows Guard and Reserve personnel under certain circumstances to qualify for veteran status, which really has the benefit of enabling the employment preference as well as the license plate seals available from DMV. Of course, anyone who served on the Guard or Reserve with a disability per federal requirements has already earned that status. Then with the board meeting, there was a question about who might be participating either virtually or in person at the NACO conference in July. That conference this year is July 9th through 12th and will be offered in both an in-person and a hybrid model in Prince George's County, Maryland. So we've been asked if you plan to attend that either way to please let our AOC team members know. So I'm not planning on attending this year. And then lastly, we took care of the annual review. Yes, it's been 1 year already for our executive director, Gina Nickel at AOC. So we spent quite a bit of time on that executive session. And also things are moving forward with the building purchase. And also you should all have received an email about the AOC listening session with regard to the new AOC membership model for next Monday, April 19th from 1 to 2. So, and that's everything. Oh, the last thing, darn. Excuse me, springtime in my nose, allergies. Unfortunately, it looks like our community has earned the risk status of high risk. The governor's office, this is what's called a warning or a signal week this week. We were just about 6 cases inside of that from last week, but our numbers this week are showing solidly that community spread has taken hold. So it looks like likely Friday the 23rd, we would move from moderate risk to high risk, which means that restaurants, for example, that have seating inside, that whichever is smaller of 50 occupants or 25% capacity would be the limit versus 150%. So luckily, we have pretty good weather right now. So outdoor seating is a really attractive offer these days. So that and continued struggles with vaccination doses. The more we get, the more we can deploy throughout our communities. We just can't seem to get enough of them. So, but that's it from me. I have a sneeze coming, sorry. Leadership communication.
Thank you, Chair Harrington, Board of Commissioners. I too struggle with seasonal allergies, so I can relate to this time of year, as beautiful as it is. And so I do want to just thank you, Commissioner Fye, for recognizing Ramadan, and happy Ramadan to all of our employees and community partners. So thank you for that recognition, Commissioner Fye. I did ask Marnie Kyle to join to give also a brief update on vaccinations and the Johnson & Johnson. Chair, thank you for your update on risk levels. And Marnie, if there's anything else you want to add to that, please do so. So let me turn it over to Marnie briefly.
Okay, good morning, Chair Harrington and Board. Marnie Kyle, Director of Health and Human Services. And thank you, Chair Harrington. I was going to provide the update. Our case rate as of yesterday was 123.2. So we're well above the 100 per 100,000, which will put us back into the high risk. It's very unlikely that we would go down by next week. So we can expect to move into that. So mostly what I wanted to share with you is really we just were notified officially this morning that the CDC and the FDA are both recommending a pause on use of Johnson & Johnson vaccine, the one-dose vaccine. And OHA has also sent out information this morning to all of us and healthcare providers and anybody that's receiving vaccine. So the pause is related to a rare type of blood clot that has been identified. It's only been reported in 6 cases, and I use the term reported. But CDC and FDA and OHA, out of an abundance of caution, are going to look at the data more closely and evaluate the risk to ensure really safety as we roll out the vaccine. So the good news is that none of our mass clinics, including the Hillsborough Stadium, are using Johnson & Johnson vaccine. So those mass clinics will continue on as normal. We did have a clinic scheduled this morning that was intending to use J&J vaccine, but we have Moderna available, and so that clinic will take place as scheduled today. So that's also really good news. In general, this will slow down the rollout across the nation in Oregon and in Washington County. But we have notified everybody that has received or had planned to receive J&J of this delay. So I just wanted to make sure you were aware of that. I'm sure the media is blasting it out, so you probably already have that information. And I'm happy to answer any questions about either moving back to high risk or the vaccine.
Well, I know you and the team have been able to see it on Facebook yourselves, but it's been really wonderful to see the sharing of gratitude from community members around all the different clinics that you and your team have enabled throughout Washington County. In addition to people being thankful that they can go to their local pharmacy, even the pharmacy at Costco as well. So keep up the good work. We're getting it done. We just need to keep encouraging people to get vaccinated as soon as you can, wherever you can. Don't make multiple appointments, or at least don't be a no-show. Go back and cancel the ones that you're not going to be showing up for because you don't want to take somebody else's space. So keep up the good work, Marnie.
Thank you.
Thank you, Marnie, for being here and sharing that update. Just as we've seen the risk levels increase for community spread, we have seen the case counts amongst employees increase. We do have 1 positive case and now 5 close contact cases. So I had hoped that I would stop bringing you these updates. However, it is an important reminder, just as our community is impacted, our employees are impacted. And so we will continue to be encouraging telework and ensuring safety in the workplace as well. As it is a board priority initiative, I did want to let you know that staff will be working with your staff assistants to schedule one-on-one discussions relative to the strategic facilities planning process and to ensure that your voices and the board's needs are centered in that input process. So please watch for those. I know your time is limited. These are really important conversations to have and so that we do center your input. And with that, I will conclude my weekly report.
Nothing to report here. Thank you.
Thank you, Tanya. Thank you, Alan. Diane, Clean Water Services.
Morning, Chair Harrington and Board of Clean Water Services. Just a quick report that things are going well at Clean Water Services. And in fact, yesterday the team had opened the counter for some walk-in service because things were looking really great and there were some customers wanting to do that. But given the shift on April 23rd, the team will reevaluate it. But our customers are accessing our online submission and the virtual meetings really well. So that's been very efficient, but the team was looking forward to seeing people again. The other thing that the team wanted me to let you know about is with the budget, we have created some learning videos on our Absorb channel. So we'll be sharing that with the board on the Thursday roundtable. We do have 2 employees that have been impacted potentially by COVID. One is a positive case, but they're teleworking and I'm told they're doing very well at home. And we have another employee that had a possible exposure, but they're also teleworking. So there has been no carryover of COVID into the workplace. So the team is doing well and they're remaining vigilant. So thank you.
Thank you, Diane. Ms. Angie, did you want to take us through some letters?
Yes, so the board received several emails this week on letters, so I would say more than the normal influx of letters. So I did collect those letters and put them in one email. Hopefully that was helpful yesterday afternoon. So we'll just walk through each of them. So the first request for a letter is actually, in essence, it would be the cover letter to the CRF report and looking for a board thumbs up to move forward with the letter. As a reminder, that formal presentation will be at next week's board meeting. So I saw the chair with thumbs up.
I read it, looks good. Jerry's thumbs up.
Okay.
Roy's shaking his head. Okay. Yep, you got 5 thumbs or
Okay.
head nods.
So the next series of 3 letters are a follow-up from last week. The first is the Beaverton Creek Trail Community Project, Tigard's Fano Creek Trail, and the third project is Banks Trailhead Parking Improvement. So looking for a thumbs up to move forward with those 3 letters. Yep, I see a nod from Commissioner Rogers. Yep. And then the final letter, the 5th letter, is input on the equity framework for the I-5 and I-205 toll projects. Yep, I think that was a yes from Commissioner Rogers. Okay, thank you for your time and we will move forward with those letters.
Terrific, thank you. And thank you, commissioners, for all of your diligence in looking at all those letters. It is unusual to have 5 all in one week, but thank you, Ms. Angie, for organizing them as well. We'll move on then to the next item on our agenda, which is a discussion of the Behavioral Health Council applicants. And welcome, Nick Ocone. Have I pronounced your name properly?
Yes, it's Nick O'Cone. You did a great job. Thank you, Chair
Nick
Harrington.
Oconee, thank you so
O'Cone.
much. Acone.
Yeah.
Nick Acone, it's a pleasure to meet you. And Marnie, did I short circuit an introduction? I'm sorry.
No, I can't remember if you all have had the pleasure of meeting Nick O'Cone yet, but he is our new Behavioral Health Division Manager, and we're thrilled that he's been promoted into this position after a national search, and he brings a ton of local experience and knowledge and expertise. So we're thrilled to have Nick joining our team, our leadership team now. So with that, I'll turn it over to Nick.
Good morning, Chair Harrington. Good morning, board. I appreciate you allowing me to come and present the recommendations from our Behavioral Health Council today. And I also want to start off with an acknowledgement that I was informed that I left some of the member profile information out of the materials I submitted, and want to let you know that I'll be doing a quick verbal bio of everybody, and we'll make sure to have those written materials submitted to all of you when we have the formal appointments that comes before the board in a couple of weeks. The Behavioral Health Council is a 19-member advisory body that provides strategic direction, inputs, and priorities and guidance to our behavioral health division. A priority of our council is to ensure consumer voice is considered at all decisions and about program direction. Another priority of our council is to ensure that we have broad representation of community members with many perspectives. And to this end, you'll notice that half of our positions are dedicated to specific areas, with many positions dedicated to our provider services. We do this because our provider network is contracted out to a series of community behavioral health providers, and we want to make sure that we're aligned with their strategic priorities as well. For this appointment, we had 7 total applicants for 5 vacant seats, and 4 of these seats were held by current members who all reapplied for another term on our council. Our council's process is to invite applicants to attend council meetings after they have submitted their application. This really allows them to see how our council works and to also be able to share with their council reasons why they want to participate. Our priorities this year was really to be expanding the cultural perspectives of the council and to fill the designated seat of community member with an identified child client. This seat was vacant for the past year, and we were really intentional about trying to recruit for it so that we didn't have any vacant seats on our council going forward. I'm going to go through and just give a quick overview on who our recommendations are now. 2 of the open positions that we had on our council were from behavioral health provider positions that needed to be endorsed by our local behavioral health provider council. That's listed in our bylaws that we will have the endorsement from them and have subsequent applications. Mary Monnet is being recommended for our child mental health provider position. Mary is the CEO and president of LifeWorks Northwest, which is one of the largest community behavioral health providers operating in Washington County, and also the provider of the county's crisis services continuum. Mary's worked with LifeWorks since 1983 and has been their CEO since 1998. Mary identified as white and female based on her application materials. Danielle Berner is being recommended for the adult addictions provider position, Danielle is a senior program manager with CODA, which is a community behavioral health agency providing substance use treatment in Washington County. She is also a Washington County resident in District 1 and has served in a leadership role with CODA for many years. She is an active and valued member of our council. Danielle left the demographic information off of her application. We have 3 additional positions that were open and are defined specifically by our bylaws. 2 of these positions have current members who are being recommended for another term. Lynn Schroeder currently fills the position of Child Serving Social Service Agency on the council. Lynn is the Director of Juvenile Services with Washington County and is a very valuable member of our council. She has served 2 terms on the council and is seeking a 3rd. There were no other applicants for this recruitment that were eligible to fill this position. Lynette identifies as white and female based on her application materials. Rebecca Jones currently fills the position representing prevention on the council. Rebecca is the executive director of the Oregon Child Abuse Solutions, which is a statewide child advocacy agency. Rebecca reports being passionate about advocating for Washington County community members at higher risk of behavioral health needs, particularly child victims of abuse, and foster youth. Rebecca lists that she is Native Hawaiian Pacific Islander and female on her application materials. The final position has been vacant for the past year, and the council would like to make the following recommendation. Stephanie Rose is being recommended for the community member with an identified child client position. Stephanie is a Washington County resident who lives in District 4, Forest Grove. She is an advocate for persons who do not have voices to advocate for themselves. She has had experience navigating the healthcare, disability, and behavioral health systems on behalf of her niece and nephew. And Stephanie identifies as bicultural, Hispanic, and female based on her application materials. We received 2 other applicants who both attended council meetings, and we have invited them to continue to attend council meetings. They've actually provided a lot of input, but there were no positions that they fit into based on our bylaws. And those applicants were Jim Bunker, who is a community partnership liaison with Cedar Hills Hospital, which is located in Washington County, and Lydia Radke, who is a Washington County resident and employee who is currently employed with Washington County Parole and Probation. And those are our recommendations that we're bringing to the board today. Thank you so much for your time.
Commissioners, do you have any questions or comments, or are you comfortable? I know I'm comfortable with what's been provided. So, okay. Well, looks like we're going to be all set on that. Thank you to the team for the work that's gone into having this application process and vetting these applicants so that we can subsequently go through the appointment process. Thanks for joining us, Nick.
Thank you. Have a good morning, everybody.
You too. Next, we'll move on to the behavioral health crisis system mapping outcome. And I think this is a great follow-up to our having the work session December 8th, where Kristen provided us with a nice overview of the mental health crisis solutions here in Washington County, particularly as we were discussing the deployment of body-worn cameras at that time. So welcome to the team and take it away.
Thank you, Chair Harrington, members of the commission. We really appreciate having us back today. With me is Jay Oslander, who is going to be co-presenting as we do a follow-up for the meeting, as you mentioned, on December 8th. At that time, there was a discussion about body-worn cameras, which really felt like it was important to also talk about crisis services. And the robust crisis services that we have in Washington County. We also had a discussion about CAHOOTS model, which is a pairing of mental health clinicians with emergency medical technicians, EMTs. And there was a discussion about holding off on any sort of decisions or further discussion until this mapping process that we had just started working on was completed. So those results are now available. So we're excited to come back and provide that information for the board today. Next slide, please. So I'll do a really quick reminder about the services that we do have in Washington County, because I think it provides really important context for the results of this mapping process that we just completed. We do have a Washington County crisis line that's available 24/7. It's a contract with Multnomah County and a collaborative with their crisis services. It's very integrated with the rest of our services. So the crisis line provides triage, crisis intervention, and also helps connect people to the rest of our crisis system. Our Hawthorne Walk-In Center is a urgent care center for individuals experiencing mental health or addictions crises, but it's also a rapid access service. So you don't have to be in crisis to access services there, but they will help people get connected into the system of care, hopefully preventing situations from escalating. But they're very integrated, and they actually act as our hub for most of our crisis services. We do have a mobile crisis team that is staffed with master's level clinicians. They can go out into the community. They also are available 24 hours a day, 7 days a week. These are clinicians that are specially trained in crisis intervention. They operate out of the Hawthorne Walk-In Center and are often co-trained so they can provide support both in the center and in the community. It's really a goal to bring the support to the individual with the crisis team. And so they can go to people's homes. They can also go to hospitals. They also do in-reach into our local jail. Our mental health response team is a very successful team that we've had for about 10 years now, where we pair a mental health clinician with a sheriff's deputy. We have 2 teams operating daily, generally from around 11 a.m. to 11 p.m. And this team really responds to 911 calls. So whereas the mobile crisis team often responds to community calls through the crisis line, our mental health response team can respond to calls that come in through the 911 system. Finally, a really integral support that we have is our peer crisis team. These are folks that have lived experience and can often provide support after a crisis is over to make sure that individuals are really getting connected to the care and supports that they need. Next slide, please. So why map the crisis system? I mean, of course, it's good practice to do this on a regular basis to make sure that we know what services and supports we have and where there might be some gaps. But the other reason why we do it is because back in 2017, Washington County passed a resolution to join what's called the Stepping Up Initiative. The Stepping Up Initiative is a national initiative that really encourages local communities, local counties, to reduce the number of individuals with behavioral health conditions who are in jails. So counties are, as part of the Stepping Up initiatives, counties are asked to conduct a really comprehensive process of evaluating what services and supports they currently have and really look for additional opportunities. So the state of Oregon, the Oregon Health Authority, is very supportive of this initiative and has actually contracted with an organization to provide support for these sort of system scans, mapping processes. So they contract with the Oregon Center on Behavioral Health and Justice Integration to provide that support during these mapping processes. Next slide, please. The mapping process uses an evidence-based practice called the sequential intercept model. So this model takes a very systematic approach at doing the system mapping, where you look at various points in a criminal justice system where individuals with behavioral health conditions may come in contact with the criminal justice system. And then looking at each of those, what's called intercept points, to determine what resources currently exist and where gaps may exist. The goal is really to divert people from going any deeper into the criminal justice system. So that's why you're looking at various points very specifically, is to really identify opportunities to divert people from going further into the system and hopefully prevent future contact with the criminal justice system. Next slide, please. So we last did this sequential intercept mapping in 2015. And so it had been 5 years. So at the end of 2020, we began a new mapping process. And back in 2015, the analysis had really 3 strong recommendations. The first was housing, developing additional housing resources for individuals with behavioral health conditions. That was not surprising at all. As we all know, housing is really challenging. And if you have a mental illness or an addiction, it can be even more so. The other recommendation included creating stabilization programs. That really lent support for our creation of the Hawthorne Walk-In Center. And so the work in creating the Hawthorne Walk-In Center really met the spirit of the recommendation from the 2015 mapping. Finally, there was a recommendation to create a jail diversion coordinator position, somebody who is located in the behavioral health department and has good knowledge of the behavioral health system of care and can really liaison and support our criminal justice system, the sheriff's office, the courts, at looking at ways that we can support our community members who have mental health and addictions concerns, and try to help develop alternatives and to help also keep people out of the jail. So was very excited to be able to hire Jay Oslander into that position, who's here today, and will now talk about the current mapping process that we just undertook. Jay?
Good day. Thank you, Kristen. Good day, Chair Harrington, commissioners. It's great to be here. Next slide, please. So as Kristen said, our task was to develop a comprehensive picture of how individuals move through our system and how we can support those with behavioral health needs. We started off, and unfortunately we had the Greater Oregon Behavioral Health and the Oregon Center on Behavioral Health Integration and Criminal Justice Integration that really was eager to help us through this process. So we worked with them. We got to know everyone we could think of who was a subject matter expert in our community and beyond. We sent out invitations to our providers, advocates, family members, everyone you could think of, and invited them to join us for what turned out to be 7 meetings. The first 6 were intercept meetings where we looked at each of these intercepts, as Kristen explained, looking at community services, law enforcement, our initial detention, jail courts, reentry, and community corrections, to map that part of the system and to come up with ideas and resources and improvement opportunities. And it's just a great opportunity where we got many of our subject matter experts and advocates and those invested in our system together to talk and to share information. So it really was a valuable experience on many levels, not to mention the map and report that came out of that process. So next slide, please. This is a very simple version of the sequential intercept model. This is what we worked from. Each of our intercepts had a group that discussed our gaps and opportunities. For instance, in Intercept 0, we brought together our crisis system, our providers, families, all sorts of folks who really talked about what can we do to support our families and individuals and community members before they ever go into crisis. And if they do have a crisis, what are the options before it becomes a risk of harm to anyone, or where we would really need law enforcement to respond, and how do we make sure those resources are available? And then we had a discussion in Intercept 1 with our law enforcement, our first responders, on how to really get that right first responder to the scene when needed, because we know we can work well to lower the number of calls that law enforcement responds to for behavioral health crises and emergencies. Yet there will still be overlapping calls for the foreseeable future where there is a question of public safety, and that we really do rely on our law enforcement to support us on that. So in Intercept 1, we had a great discussion on how to get that first responder, the right first responder, and when it is law enforcement, how do we partner with law enforcement and our sheriff's office and all of our agencies to make sure they have the information and resources they need to effectively manage that call. And so on through these intercepts. We're lucky to have our sheriff's office leadership be so interested in making our jail work the best it can for individuals with behavioral health needs, knowing that those with behavioral health issues can end up in the system in ways it's stuck in the system. And if we don't counteract that, it really isn't a fair system. So next slide, please. So we brought all those groups together. So we had those individual groups, then we brought them all together for a half-day virtual meeting where we made a map of the system, and we basically voted on priorities and really looked at where is everyone feeling the next steps need to be. What really are the priorities to make the next steps for our system? After that, this was on December 17th, where we had our big meeting, and we invited several hundred individuals, and at least 50 to 80 individuals were a part of this process. We, about a month later, got a report draft back from the Greater Oregon Behavioral Health. And at that point, we asked for community feedback. Can I have the next slide, please? So with help from the Office of Community Engagement and from our Public Information Officer and others, we really sent it out to as many individuals in parts of the community as we could, hoping to reach and hear from individuals who we don't we wouldn't know or normally know and have relationships with, to encourage them to read this draft. If you'd like, send us email back, send me an email, the writer an email back on what you'd like to see changed or what you'd like to discuss for the final draft. We also invited anyone to attend one of 2 Zoom sessions, and we created a survey that anyone could respond to. We had a couple dozen responses to the survey. That what I believe is that a lot of individuals saw the report. I think it would be hard to respond without really thinking and having a lot of knowledge. So I was happy to see that we had a good number of responses, but each of those responses were rich. So the individuals who did respond to the survey or attended the Zoom sessions had information, had stuff to share, and we definitely met some new allies and advocates in our work through that process. So even though I'd say with the community input, I'd be cautious to put any statistical significance because of the smaller number of individuals. It was a really rich discussion, and it's all on recording too, which is available. And for me, that was actually the most rewarding part of the process. Next slide, please. And I think we'll get to our recommendations, and I'll pass it to Kristen.
Yeah, so the report came back with basically 5 recommendations, which we then also looked at the recommendations from the community members, which I will come back to. The first recommendation was not surprising whatsoever, which is again related to housing. And specifically, the report had a focus on looking at shelter beds and also a recognition of the challenges that individuals who have are registered sex offenses, that they really have a lot of challenges in getting support and housing for themselves. So recommendation number 1 was not surprising at all to us. The second recommendation really focused on getting more clinicians out into our community, having a real rapid response within our community. And they specifically called out the mental health response team and a desire to expand our team. As I mentioned before, that team is currently 2 teams daily from about 11 a.m. to 11 p.m. So one of the challenges with that team is that we have a relatively large geographic spread for our county. And so there are calls that they aren't able to respond to just simply because of being at a distance or on other calls. Next slide, please. The third recommendation was to create an emergency detox center. And so I'll talk about that recommendation here in just a minute. And then the final recommendations looked at creating a position that's really a liaison between the behavioral health program and the circuit court, really looking at opportunities to help support individuals who have behavioral health conditions who are involved in the court system. What can we do to really support those individuals in successfully navigating the court system and getting connected to services in our community? And then finally, the final recommendation was really a desire for increasing some service capacity in our community, specifically related to residential treatment beds. And so this was called out as a real need in Washington County, where we don't have a lot of residential treatment beds. Next slide, please. So the community feedback was generally pretty aligned with the feedback that was, or the recommendations that were in the report. So you'll notice all of the ones that have asterisks are very much aligned. What we did see is that there was additional emphasis on housing, not just shelter, but really looking at affordable and permanent housing, and that being a need as well. So that was some of the feedback that we did get from community members. Another area that we saw some additional feedback from community members is really, again, responding, while there was support for expanding the mental health response team, there was also support for expanding other models of crisis response in our community. And so I think this is where we go back to the discussion that we had at the last meeting about would a cahoots model where you have a mental health clinician with a medical technician, an EMT, would that be a model to consider in Washington County? Again, this was feedback from a few people, so it wasn't a strong response, but I think it's important to acknowledge that we did hear a desire for additional crisis response resources that are not paired with law enforcement. That said, again, there was also support for expanding the mental health response team where law enforcement is involved. Next slide, please. So here's where the next steps come in. One of the things that we really appreciaed about this report is that it validated a lot of the direction that the behavioral health program is already going. As you know, the behavioral health program, as well as HHS in general, is really supportive of the new supportive housing services implementation work that our Department of Housing Services is doing. We will be bringing back this information and the real desire for considering the behavioral health needs as we're expanding supportive housing and shelter options within our community. So the other is the behavioral health program has developed a concept for the Center for Addictions Triage and Treatment, which I will be bringing before the board in partnership with Chair Harrington in the future. But a lot of the recommendations that were in the SIM mapping report were very aligned. For instance, calling out specifically the need for detox services. We don't have any publicly funded detox services in Washington County. And so that was just very much aligned with the work that's already happening. As is a peer-run drop-in center. That is one of the components that we're looking at in the concept for the Center for Addictions Triage and Treatment, as well as additional residential treatment beds. Finally, I did want to talk a bit about expanding the mental health response team. We have actually been receiving a lot of interest from cities within Washington County to expand the mental health response team and to partner with Washington County Behavioral Health and the Sheriff's Office in expanding the team to be an interagency model. In addition, the cities have expressed interest in funding clinicians as well as providing their own law enforcement officers to start providing a interagency team as opposed to a team that's solely Washington County Sheriff's Office and Behavioral Health. So we're talking with the cities and looking at creating IGAs that will fund clinicians. And the current, at this point, it's looking like we'll be able to expand the team both in terms of hours and numbers of teams, so that we'll have 4 teams available daily instead of the 2 teams that we have available daily. This would be assuming that the cities are able to fund the clinicians through their budget process. And so we're just, at this point, it's sounding very promising, and we're really encouraged by the desire of the cities to start participating in that team. So I will stop there and would love to answer any questions that you might have.
Commissioners, questions or comments? Not from Commissioner Treese. Anyone else? Not from Commissioner Willie?
Kristen,
Go ahead, Commissioner Rogers.
Kristen, this is Roy. I see that you're taking some major actions. They certainly are interesting and a much needed expansion of certain services. But I guess I come back to budget all the time. What you're proposing is costly. And have you done any prediction on what it would cost, not just in a year, but over some period of time, especially as our partners might fund, but then they have budget shortages and they may pull out. And so I'm always concerned about things that aren't somewhat fixed in time and money, so that we don't get into something and then all of a sudden find that we don't have the resources and we don't have the, I guess, the resolve to stick in in the program for a long period of time. So that's one. And the second one is I continue to beat the drum, and I guess it's just because of where I'm located, but services aren't really readily available in the south part of the county. And it's always a challenge for people to try to find some kind of transportation to the Hillsborough area. So can you talk about that a bit too?
Yes, thank you, Commissioner Rogers. Let me start by saying that the mental health response team expansion, actually the cities have come to us and expressed willingness to fund the additional clinicians. So it won't come back to the behavioral health division to fund those clinicians. The team is a model where we can expand and contract as resources are available. So should those resources go away in the future, we won't be on the hook for continuing the model. We may choose that it's a priority, but if we don't have the resources, we can contract the team if necessary. And so we have been in contact with the city of Hillsborough, the city of Beaverton, city of Sherwood, city of Tigard, and city of Tualatin, all who have expressed a desire to add funding for clinicians in their budget cycles. And so we're working on some draft IGAs at this point. And what would happen is those funds would come to the behavioral health program, and then we would contract it out to LifeWorks Northwest, who operates the mental health response team. So as for your question about South cities and making sure that we have geographic distribution across the entire community, that's the great thing about expanding this team is that we will actually be able to station the teams in various parts of the community. Whereas before, with only 2 teams, they were largely based in the Hillsborough and Beaverton areas because of where our precincts are for the sheriff's office. They could respond everywhere in the county, but again, the geography created some challenges there. We have talked with the cities of Tualatin, Tigard, and Sherwood about stationing a team down in South County so that the team is located there. They will be paired with officers from those police departments so that they can serve the South County area and make sure that they have access to the same service as the northern part of the community. So we are paying very close attention to that issue and that concern, and trying to look at how to make sure that the services are widely available.
Thank you, Commissioner Rogers. Commissioner Fye, do you have anything?
Thank you, Chair. Kristen and Jay, nice to meet you both, and great presentation. You know, one of the things, I really enjoyed your presentation, and one of the things that was coming up for me when I was listening in, obviously this is my first time, I wasn't part of the December conversation. However, you know, I think we need to be very clear of making sure that we don't send a message that one size fits all. Obviously, the current process that exists is problematic for certain populations of our community. And so I really want us to, for future recommendations and process that we evaluate, to really center culturally and linguistically appropriate, and to signal that respect to the community and that care. And also, I appreciate you aligning your recommendation for the supporting housing services, because I think a lot of the community, as I participated the tail end of that committee, people were really strong about making sure that we align our service design to the population. So I'm wondering if you all, you know, considered how problematic it is to certain our populations, and then the expansion that you're really focusing on. How do you intend to make sure that it's relevant to the community that we're going to service? Because it doesn't matter what process we create, if it's not going to be appropriately delivered to the community, then we'll either have underutilization of services, or we'll have services that detrimentally impact or continue to further perpetuate, disparities and harm.
Thank you, Commissioner Fye. I really appreciate your input. And I think that for us, we have to ground everything in being responsive to the entire community and really looking at all of the different services as we're expanding and growing from that lens. I will say that, going back to Nick O'Cone's presentation earlier about really looking at the Behavioral Health Council and trying to have as much diversity as possible in perspective at that level is really important, because that group really has provided us with a lot of the direction about our crisis program and making sure that it is very accessible to community members. As part of our Center for Addictions Triage and Treatment concept that we're developing, we're specifically reaching out to a variety of community groups, including culturally specific groups, to talk to them about how do we make services accessible? What do we need to do to make sure that we are providing services in a way that is culturally responsive and really is meeting the needs of the community. And so that's the approach that we're taking as we're moving forward with all of our service delivery growth and development, is really trying to reach into the communities and have these conversations with them. All that said, we are also working hard at making sure that our crisis clinicians are trained to provide culturally responsive services, and making sure that we have services that are linguistically accessible to our community through the use of language lines. I realize that's not ideal. At this point, we really want to hire and retain as much of a diverse workforce as possible. And I will admit that that is challenging at this moment. We're just having a hard time recruiting in general because the workforce is very tight. But again, those are areas that we intend to completely center on moving forward.
Thank you. And thank you, Chair. I don't have any other questions.
Okay. Well, thank you, Kristen. I learned some new things through the responses to those questions. I just have a few. I really appreciate how you and Jay have been highlighting the multiple service levels, and how you are going about trying to bolster the workforce, as well as ensure that there is training so that the delivery of mental health services, no matter where someone approaches the system based upon their experience, is culturally responsible and has appropriate linguistic support. I will say that as various city councils in Washington County have expressed interest and willingness to continue to expand the mental health response teams, I've heard from city councilors directly from the city of Beaverton and the city of Tualatin concern about our delivering expanded services with the partnership with law enforcement. And so this is where I think we have to always give the presentation, as you did here in the one slide that talks about the continuum, right? That it's not, I don't mean to use the word continuum because it's not about moving levels, but rather there are many front doors. And I think that's really important. Where is the report available?
I believe we were planning on putting it on our website. We're updating our web page currently, and so, but it will be placed on there.
Okay, I'm just used to a report being available with the summary to us.
I do have the link that I could provide. We have it linked to the website.
Okay, that'd be good. On slide 11, which is the first slide of the recommendations, I see with the recommendation number 1 on shelter, temporary and transitional support housing, I could see how the Washington County Supportive Housing Services Program will meet the first 2 sub-bullet points there. But on the registered sex offenders, I'd like to read the report and see what options we may need to pursue for that.
Chair Harrington, if I may, I will say that I am part of the supportive housing development work that's happening in the Department of Housing Services. And we have had discussions about the need to support individuals with criminal justice involvement, including sex offenders. So that those conversations are happening, but perhaps are not getting reflected so much at this point.
Yeah, I don't doubt the department's intentions at all. I would just like to get more familiar with it because I believe in the principle that, everyone's life is important, and how do we make sure that folks can move forward and have a fulfilling life and opportunities. On slide 7, I just wanted to share that I had briefings with one of the co-chairs, Representative Dan Rayfield, co-chair for House Ways and Means, and then with Senators Elizabeth Steiner and Betsy Johnson, the Senate Ways and Means co-chairs. And particularly with the 2 senators, I was surprised by the level of, I label it as skepticism about county level work, both around behavioral health as well as with community corrections. They, I think they're skeptical about continuing to provide current budgeted funding. We have to, as I heard from them, we have to demonstrate to them how we're doing on performance metrics and what we're already doing and how that is leading to addressing community need. How many interventions are we involved with, and what is our performance level? And also, how can, if we're asking them to fund a program, how do we anticipate sustaining that level of performance over at least 4+ years? And it's really interesting to hear how skeptical they are about the work that's already done. So we have to, my sense is that we have to demonstrate that there is science behind the techniques that we're implementing to, and then what is our actual performance, and then also do a much crisper job of demonstrating what the community need is and why we need to get more of their support. I was surprised by the level of skepticism, I'll just say that, which means that at every single point of contact with them, it's important to demonstrate, gosh, I can't seem to put my finger on the slide right. Oh, the current service slide, slide 3, where you have the different services. And then we have to have a one pager that articulates what our current services are based on what successful models and what are some very crisp, short metrics that demonstrate that we are performing, which of course all takes work to do and put together. So that was interesting. I appreciated hearing about the sequential intercept mapping from 2015. You spoke about the housing stabilization program and the jail diversion coordinator. I just want to ask that you did indeed, as a result of that 2015 effort, you did create that jail diversion coordinator position? Okay, great.
Yes, we did.
Okay, terrific. Those were all the questions I had. I learned a lot and I appreciated the scope of everything that you've brought forward.
Thank you, Chair Harrington, commissioners.
Thank you.
Questions or comments from anyone? As I survey all the little squares here on my monitor. Okay, thank you. Keep up the good work. Now, commissioners, we have a break here, but our next work session topic has outside speakers. So we're going to take a short break, just 10 minutes, and reconvene at 10 o'clock. Okay? See you back here in a bit. Hey, Tanya, guess what? It's still day 2. I know, it's awesome.
Yay, that's good news.
Uh-huh. Yeah. We'll build on that.
Jigit, are you and I having a diploma competition?
Docker, I think I win that battle.
I think I might have one up on you. I'm not sure.
Well, you both have me beat. I'm the least educated person in my family. Not a badge of honor, just a fact.
Oh, but Chair Harrington, your emotional intelligence is really what matters most.
Thank you. So Jagjit, will you be doing our introduction, or Latricia?
Madam Chair, I'll be handling the introduction. Thank you.
Okay, great. All righty. Well, we'll be ready in about a minute. Do we have all of our outside guests, or are we still waiting?
I think we're just waiting for Representative Campos.
Great.
Board Clerk, I believe there was a last PowerPoint. Sorry, that I sent. Perfect.
Oh, there's Representative Campos's entry. Jagjit, it looks like you have everyone. So welcome back, everyone, from our break of the Washington County Board of Commissioners work session for April 13th, 2020. And so for the this next item on our work session, the BIPOC Caucus Legislative Agenda Briefing, I'd like to turn it over to Jagjit Nagra from our Government Relations team.
Thank you, Madam Chair. For the record, and good morning, everyone. My name is Jagjit Nagar, Government Relations Manager here at Washington County. This morning, I have the distinct honor of introducing both Representative Campos, State Representative for District 28, covering portions of Iowa and Beaverton, and then also Zakir Khan, who is Legislative Director for Representative Bynum for his District 51, Clackamas portion of the Peace Portland. Today's presentation was really at the request of Commissioner Nifiza Fai, so I want to give a shout out to her with a great idea there. And with that, I will turn it over to Representative Campos. And Zakir, thank you so much.
Well, thank you so much for having us this morning. We are pleased to join you. My name is Winsve Campos, State Representative for House District 28, the Iowa Beaverton area. I use she, her pronouns, and I'm going to pass it over to my co-presenter to introduce themselves.
Thank you, Rep. Campos. My name is Zakir Khan. I'm the Chief of Staff and I guess, now Chief of Staff, formerly Legislative Director for Representative Janelle Bynum, House District 51, representing Clackamas, Southeast Portland, Damascus, Happy Valley, a range of cities there. So really honored to be here. I'm actually a resident of Washington County myself. So happy to get this kicked off, and I'll just turn it right back over to Rep. Campos after saying my pronouns, which is he and him. Thank you.
So we are proud to join you this morning to present the Oregon Legislative BIPOC Caucus's legislative agenda. And of course, BIPOC stands for Black, Indigenous, and People of Color. So if we could go to the next slide. Here we have the faces of our, of what the BIPOC Caucus sort of looks like. We do not have, I will give the caveat, we do not have the most up-to-date presentation, slideshow presentation this morning, but we will strive to get that to you within about a week. We are facing a big deadline today where we are going to see our priorities will be very focused as bills make it past this chamber deadline. So we will be updating the slideshow at that point in time. So we will follow up with this presentation. But as you see here, we have not yet added Representative Andrea Valderrama, who we are excited has joined us in the legislature. And we also have past member Akasha Lawrence Spence on here, whose work still lives on this session. There are a number of different members that are carrying on some of what she started working on while she was with us in the legislature. So next slide, please. So we are very proud that this year we've put together this agenda. We've put together our priorities, our mission, our vision, our values, all of those things. And as we will see, some of the legislative concepts and bills that we are prioritizing and the issues that we see as a priority. We envision an Oregon that is diverse, dynamic, just, and equitable, where everyone has an opportunity to thrive, where our communities are self-sufficient, where they have full agency so that they can meet their needs, afford their basics, and so much more. We also envision an Oregon where oppression and racial disparities are non-existent, where everyone can live their full lives regardless of their background, their race, their identity, where we also envision an Oregon which allows a distributed and collective power, recognizing that that is also a form of leadership. These are things that we as a BIPOC caucus within the first few weeks before even session started were things that we wanted to pin down. What are the things that we would like to see in Oregon? What are we striving for? Next slide, please. So our mission is to advance racial equity initiatives and eliminate systemic oppression and racism in Oregon. And so the ways in which we're looking to advance our mission are by introducing and advancing policies that surround these issues, right? That seek to eliminate racial disparities, to remove systemic and institutional barriers that BIPOC folks face, by making sure that we have folks at the decision-making tables in those rooms, that we have folks in leadership that represent so many of our diverse communities. That means that we are working outside of the legislature as well to support school board members, to support city councilors, to support more folks so that we have representation in all levels of government. We are also encouraging folks to get involved civically, to have participation at our local boards, on our water boards, all of these things that we know exist, but aren't necessarily always the most accessible things, or things that our communities necessarily know are available to them for them to be able to engage. We are working on broad coalitions, making sure that we are connecting with partners, with stakeholders, and that we also have a support system for members and staff and interns of color and those allies that work at the legislature. My co-presenter may want to mention it, but I do know that there is staffers have formed a space where BIPOC staffers can meet and discuss and have that space of affinity. We also, as a BIPOC caucus, want to make sure that we are working towards a safe space for members of color in the Capitol. That means calling out racism when we see it. That means pushing back when folks members of color feel uncomfortable in spaces. It also means that we are asserting our own power, that we are not just that we're holding folks accountable, that we're holding their feet to the fire, that when we're talking about these issues that are important to communities of color, that we are seeing action, so that we can make sure that we are celebrating and honoring the distinct lived experiences of all of our members of all of our communities. Next slide, please.
Or I'll take it over here on this slide. So the BIPOC caucus laid out a plan for 10 main priorities that they were going to address through a variety of different means this session. First is police accountability, criminal justice reform, economic opportunity, education, BIPOC healthcare access, housing and homeownership, expanding access to democracy, equitable and transparent government, environmental and climate justice, and then protecting and expanding critical social services. Next slide, please. So the kind of main themes here with regards to police accountability was increasing the manners in which we are able to protect BIPOC populations from unjust systems of policing, changing criminal justice reform, and driving home those efforts, and then providing economic opportunities for workers through targeted investments that we can make in protecting and helping them. Next slide, please. So you'll see a couple of different items on this slide, and I actually have an update for you because Representative Bynum, or Chair Bynum, through members of the Judiciary Committee, actually passed through a bipartisan slate of police accountability bills. In all total, it's a total of 12 bills. I'll detail what those are just briefly here, which is number one, House Bill 2162 that deals with DPSSC training and requires accreditation or suggests, highly recommends accreditation of departments. House Bill 2513, which requires that officers learn CPR. House Bill 2928, which places regulations on the use of crowd control munitions. House Bill 2929, that codifies the manner in which officers must utilize a duty to intervene when they are witnessing misconduct. House Bill 2930, which modifies arbitration, which has been a key point that the counties have been trying to address for quite some time now. House Bill 2932, which mandates that departments need to report their data to the FBI use of force database. House Bill 2936, which mandates that the character of an officer is properly investigated and that we don't have any people with far right or rather Proud Boys or anybody who's involved in the insurrection really looking at their character of officers to make sure that those people are not a part of police departments. House Bill 3059 modifies the unlawful assembly statute. House Bill 3145 will result in publishing police misconduct records of economic sanctions. House Bill 3355 allows for easier identification of officers. House Bill 3047, our fellow colleague Representative Post testified towards this, as well as a bunch of other representatives as well, that a lot of public officials have been being doxxed. A lot of protesters have been doxxed, a lot of officers have been doxxed. So this creates a civil action so that any individual who is doxxed can file a case against the offender. And then finally, House Bill 3273, which bans mugshots. Next slide, please. On criminal justice reform, the main bill that I'll be talking about here is the Cannabis Equity Act, House Bill 3112. So this reinvests revenue from this act back into BIPOC community through land ownership, job training, wealth creation, and automatic expungements of cannabis-related convictions. This is coming up for a vote before the House Judiciary Committee today. And with that, I will turn it back over to Rep. Campos.
Thank you. So criminal justice reform is the slide that we are on.
Oh, so next slide.
Yeah, thank you. Sorry. I was like, wait a minute. Because we split up the slides and we don't have the slides numbered. So I'm like, so economic opportunity. You will see here a couple of bills that are, as I noted, we're not fully up to date, but I do know that the Crown Act is something that folks are, that has been brought back this session, that Rep. Bynum continues to work on and push, and it is something that we as a BIPOC caucus are really supportive of. We want to make sure that we are supportive of Rep. Bynum in this work, to make sure, and I know there are other legislators working on this, but I know that she has championed this, to make sure that we are creating a respectful and open world for natural hair. It prohibits the discrimination on the basis of hairstyle. We know that too many folks, we've heard from students who go to school and are harassed because of the way in which they have their hair, that have been punished in classrooms as a result. These are the sorts of things we certainly don't want to see. We've got House Bill 2588 on here, farm worker and outdoor worker protections. I believe this is a bill that is not currently alive, is I guess the term that I would use there. I could be wrong. I don't think I am, but I'm sure we will see it again. Its intent is to protect outdoor workers from unhealthy air quality. We know that so many of our farm workers are essential workers that were on the front lines during the pandemic, during the wildfires, who made sure that we were continuing to receive food at our grocery stores, that they were out working in unhealthy air, and we want to make sure that we're protecting folks, that we are addressing vestiges of racism where we're not treating folks in labor equally because of the color of their skin. The other one here, raising the Oregon minimum wage, it is dead for this session. It is a conversation that we are having. We know that so many of our communities that work at minimum wage, that are trying to survive on minimum wage, are communities of color. We know that we're not at a point in time anymore where it's high school students that are just having minimum wage jobs. That minimum wage has not matched the cost of living, as rent has continued to go up, as the cost of childcare has continued to increase. So it is a conversation we are having, and I'm sure we will continue to have between now and the next session. Vendor Access to Economic Opportunity Act seeks to support small business, sidewalk vendors, and prioritizes public health. I don't know the status of that bill. But again, we will make sure to have an updated slide PowerPoint to you. But I think, what we want to make sure we're taking away from here is the theme of economic opportunity. It is something that it is critical for our communities to have upward mobility, for us to empower our communities of color. Next slide, please. So continuing on with our top 10 priorities, we have education, which, we seek to remove student achievement barriers at all levels by enhancing school environments, reducing over-testing, and prioritizing student voices. And again, making sure that we are making those spaces accessible to communities that historically have been left out. Priority number 5, BIPOC healthcare access, to expand and invest to provide access to culturally sensitive, to linguistically appropriate, to mental health, mental, behavioral, physical, and telehealth BIPOC providers, and also acknowledging racism as a public health crisis. Priority number 6, housing and home ownership, expanding options for building housing and attaining ownership, and providing communities a voice in property development. Next slide, please. So for education, there are a number of bills, some of which have already hit the floor and we have already voted on. But here are some of the ones that we are seeing this session. House Bill 2590 seeks to develop policies to improve success for students who have been systemically underrepresented in higher education. House Bill 2495 ensures that students receive specified services such as assigned classwork and behavioral support during suspensions or expulsions. We certainly don't want to make sure that folks are losing class time during these suspensions or expulsions, particularly because, again, we know that that students of color are disproportionately impacted by these disciplinary measures. House Bill 2937 seeks to protect students who experience harassment, discrimination, or intimidation based on race, color, religion, gender identity, sexual orientation, disability, or national origin by providing them with certain claims of actions. House Bill 2570 requires the Department of Ed, in consultation with the STEM Investment Council, to develop a long-term plan to provide computer science ed to every public school student. This is something, we want to make sure we continue to see in the years to come, the growth of STEM in our public schools. Ethnic studies in higher education. Here we've got what was formerly the LC number, provides or requires incoming students at a four-year educational institution to take an ethnic studies course as a general education requirement in baccalaureate education. And then Senate Bill 609 to develop policies to improve success for students who have been systematically underrepresented in higher education. Again, you see this theme here of making sure that we are creating equitable access for our students of color. Next slide, please.
Thank you, Rep. Campos. As this pandemic has happened, we have seen a shockingly high amount of mental health crises. And we have seen a growing substance use disorder situation that is just getting bad to worse every single day, coupled with a mental health care system in this state that has been inadequately funded for quite some time now. Representative Bynum, as well as members of this own commission, crafted a letter to the governor to addressing this over the summer. As we saw this crisis, we were all very concerned about it. House Bill 2949 and House Bills 2361 are solutions and are the forwarding or the advancement of that letter that we crafted over the summer. House Bill 2949 has elements of 2361 now blended into it, so I'm going to primarily be focusing on that bill. It's now been unanimously approved through the House Behavioral Health Committee, and it's headed to the Ways and Means Committee. This is a $200 million investment into Oregon's mental health care system. And I'll break down the four kind of main items that this covers, which is number one, $110 million investment into BIPOC workforce development, as well as for rural communities, because we know rural mental health has been shortchanged quite significantly. The second thing is supervision costs. So many people don't know this, but many practitioners who are pre-licensure have to pay for supervision costs that can number anywhere from $3,000 to $5,000. This means that a person who is making $45,000 a year as an associate can be bumped down towards basically making a minimum wage salary, even though they have a master's degree in hand. It financially does not make sense. So we want to ensure that no practitioner here in the state of Oregon has to pay for supervision fees ever again. That this is something that the state will take care of for them to help create that economic opportunity. We have $20 million going for community corrections, because we know that's a source of great need that the counties have frequently discussed with us. And then a $50 million fund towards taking care of the needs of BIPOC communities, and then also rural communities who've been disproportionately impacted by the COVID-19 pandemic. It's really important to note with regards to that $110 million of workforce development is that it is all encompassing. And what I mean by that is that there are items in there that talk about student loan forgiveness and grants for people who are coming up through the workforce. We're talking about childcare being covered by the state so that people can go to schools, because quite often what we have seen is that it's often privileged individuals who are able to pursue a career in mental health care because many of those other needs are taken care of. We don't want that to be the case. We believe in order to fix our workforce issues that everyone should have equal access and economic opportunity towards getting there. And we based this workforce development and these funds based off of a model in California that said, basically, if you can get people out of school with limited debt and you can get them into good paying jobs, it creates staying power even in rural communities. If they can buy a home there, they will stay there. And too often, we have had this economic flight that has led to BIPOC communities being shortchanged in terms of coverage and care, and rural communities not getting the adequate necessary workforce that they need in order to deal with the ever-growing problems that they have to deal with. So this is a really substantive investment. I was really honored to see that the Washington County Board of Commissioners came out with a statement in support of it. That was really tremendous, and I want to thank you for that effort. And with that, on the next slide, I'll turn it back over to Rep. Campos.
Thank you. And I'll just add really quickly to the healthcare slide. One of the bills that you will see in the updated version will be House Bill 3352, which today has a work session. We expect that it will head over to Ways and Means that seeks to expand Medicaid access to undocumented adults, which currently do not have that access. Thanks to the work of so many folks, we have Cover All Kids, but we still have work to do there. And so that's a bill that today we should see head over to Ways and Means. We've got a number of different BIPOC caucus legislators signed on to that one. So housing and home ownership. Historically, and we know that even in recent years, we've had to address some of the things that exist within our Constitution that have kept communities of color, that have kept, particularly, I know a pretty recent conversation was the way in which Black communities have been kept away from home ownership throughout the years in Oregon's history. So there's a lot of work to do around home ownership. There's a lot of work to do around addressing the housing crisis. One of the things that I found really interesting is that whichever legislator, this has proved true thus far in conversations that I've had, whichever legislator you talk to, housing remains in their top 3 priorities. We are facing a crisis that disproportionately impacts communities of color, and it ties into so many of the other issues that we're talking about today, whether that be access to healthcare, access to economic opportunity. It's all holistic. And so we know that there are far too many folks that are communities of color that are one paycheck away from losing their housing, that aren't able to access or understand eviction documents or the eviction moratorium because it's not in the language that they speak. And so those are some of the things that we're working on this session. We've had a couple of things pass. I think we have one bill coming to the floor today that is not listed on here, but that does seek to make sure that we have languages, more things available, more documents available in more languages, just as a standard with regards to housing documents. So here we have on this screen, no cause evictions, a bill that I'm sure we will be seeing again in coming sessions. It seeks to build on some of the work that has been done in the legislature with Senate Bill 608. But as of right now, folks can still be no cause evicted. No cause evictions we have seen have been used as discriminatory practices to really we have seen that it has been used as a tool in that sense. And so we want to make sure that we are protecting tenants from unfair no cause evictions and clarify damages that are available to tenants when these things happen. The agricultural worker housing tax credit, House Bill 2096, improves agricultural workers housing by bolstering available tax credits. We want to make sure that we are taking care of our frontline workers, our essential workers who aren't always paid equally to them, to the labor that they do, and sometimes can't access housing with the way in which housing costs continue to increase. So we want to make that path easier for them. So that is what this bill seeks to address. And then Senate Bill 79 promotes BIPOC home ownership by providing grants, loans, and technical assistance for down payments through home ownership assistance account funds. I've seen that this bill in a number has been, this issue has been addressed in a number of different ways this legislative session. It's something we will continue to work on, again, knowing that we have more folks who are not communities of color that are able to access home ownership opportunities. And we have laws that have set us up to being at this point in time where we are today with that reality. Next slide, please. So continuing on with our priorities, priority number 7, to expand access to democracy, ensure equitable access to the ballot and voting rights and ability to run for office. And I'm really excited about getting to this slide. I think there are a couple of bills today that have work sessions, and it will be great to see those moving forward. But I'll save saying more on that on the next slide. Priority number 8, equitable and transparent government, to make the Capitol more accessible to community, lobbyists, non-native English speakers, and potential legislators. Number 9, environmental and climate justice, to ensure an equitable transition to a renewable and regenerative economy. Priority number 10, to protect and expand social services through revenue reform. And I'll take a moment here to say, top 10 priorities. We had numerous conversations about the way in which we wanted to lay out this presentation, the way in which we wanted to build our agenda. And this, I think, is a great place where we landed on determining these top 10 priorities. But there is so much that we wanted to include that but we didn't want to have a deluge of words of all of these priorities that we care about. And so we feel really proud to have come to this point of these top 10 priorities. But we so much appreciate that folks are taking these things into account. Next slide, please. So expanding access to democracy, campaign finance reform. It is something you will hear a lot about from many legislators, but for those of us who are members of the BIPOC caucus, it's something that we are really passionate about because we know that, again, looking at economic opportunity and the way in which so many folks from our communities come from families that have struggled, from low-income backgrounds. And that's not to say that's everybody, right? It's not a monolith, but we are disproportionately impacted by the lack of economic opportunity. And so when there is an undue power of special interests in elections, when there's so much money flowing, it makes it more challenging for those of us that represent our communities, our diverse communities, to access these spaces. And that shouldn't be the way it is. We want to make sure that we are creating these opportunities for folks, that it is accessible. So limiting campaign contributions is one of those ways in which we are examining to expand that access to democracy. House Bill 2366, restoring voting rights for incarcerated folks. I don't know if anyone has seen, I think it's this bill that John Legend has given testimony on. It is, so if anyone is interested in watching that, I believe it's all over social media, or it was a few days ago. But certainly, we talk about folks we talk about the need to engage in democracy, about the need to vote, about the need to have a voice in the policies that affect us and the people that we elect. And for those who are incarcerated are still a part of these communities, of our society. Their voices still matter. And we want to make sure that we are working to make sure that's a lot of make sures that I just said there, that they can access, that their voices are heard in this process. 17-year-old voters, expanding young adults' right to vote in primary elections. Again, if we're going to tell people to engage in democracy, we have to give them the tools to do so, whether that's at the school board level, which we know 17-year-olds are impacted by day to day, or outside of that, city councils, state representatives, state senators, we know that their families are impacted by these issues, that a lot of 17-year-old voters have seen more life than we recognize these days. And so they should have that voice. And then universal representation for immigrant Oregonians. It would be the nation's first universal and statewide holistic approach to defensive and affirmative immigration legal services. One of the things that I was really excited about when I heard about this bill was being proactive and not working on the other end of things when things have already happened, and trying to catch up and always running behind the bus instead of getting out ahead of things. And so that's one of these things that this bill seeks to address, is in making sure we have systems set up for our communities to access and not to have to scramble when folks are already struggling, when folks are drowning, when folks feel trapped. Next slide, please. And I believe I'm passing it back over.
Thank you, Representative Campos. So on this slide, a couple of key things. The updating the state song is a critical one, so that it is advanced with the nature of our state the way it is now, not the way it was before. And then also making Juneteenth a state holiday. Both of these bills, I believe, are on the House desk at the moment, so they should be coming up for a vote soon. We also wanted to codify the Governor's Racial Justice Council that has played a really key role in advancing a lot of really important positions on a variety of different issues, including both mental health and criminal justice reform. So that's House Bill 2167. House Bill 2526 renames Columbus Day to be Indigenous Peoples Day, a really important marker for us to acknowledge the role in the history of Indigenous people. LC 1249 dealt with legislator pay. The legislature has not always created an equitable atmosphere for people to be working within it. And I know a lot of legislators, especially like Representative Bynum, I've seen how hard she has worked throughout the pandemic. We want a lot of other people to be able to come into the legislature and have that same economic opportunity, but also be able to, provide for their families. And so that's what that bill dealt with. And then we have the Office of Immigrant and Refugee Advancement. This is to create an office to oversee the state immigrant and refugee programs so that we can help with immediate needs with long-term support. And with that, you can go next slide, and I'll turn it right back over to Rep. Campos.
Environmental and climate justice. I will say that Rep. Pham in particular has done some great work around these issues. She is championing so much work around addressing our environment and climate, and making sure that we know it's a priority, particularly for communities of color that are disproportionately impacted by natural disasters. And some of these things that are addressed specifically here. House Bill 2490 it has been voted on the floor successfully. It is headed over to the Senate. It authorizes the Public Utility Commission to consider energy burden in utility rates, which essentially means, that we're taking into account those who are more burdened by these costs. It also promotes public participation in PUC processes. And if I were Rep. Pham, I would tell you what PUC stands for. I believe it's Public Utility Commission. I'm seeing nodding. Okay, great, fantastic. I should know that. at the top of my head. Took a moment there. Next bill is House Bill 2842, which is the Healthy Homes Program, successfully voted out of Housing Committee. I want to say that was last week. Establishes this program to repair and rehabilitate low-income households. This is something that so many folks have said would have been greatly impactful during the wildfire season that we saw this last year. We know that there are older that we've got places with infrastructure that isn't up to date, and that more often than not, it is low-income households in those spaces. And so there were many people that didn't have that infrastructure to have clean air inside of their homes last summer. And so this is a great, this bill is a fantastic step towards addressing these sorts of inequities. And then we've got House Bill 2995, 100% clean energy, which tackles climate change by transitioning to 100% clean electricity. I don't know the status of this bill, have not tracked this one as much, but I've heard some rumblings. Things are going well. These are the top three. I believe there is a website actually for these top three bills. I want to say it's Clean Energy Oregon, or yes, I think that's right, Clean Energy Oregon, where you can read up more on these bills, follow them as they move through the legislature. Really excited about these, really grateful for Representative Pham. And yes, absolutely, there are other legislators working on this, but you know, as we talk about and uplift members of the BIPOC caucus, want to make sure that folks know that she is rocking it and is championing some great things around these issues. Next slide, please. And I believe it is so me that is speaking, right? Is that right? Yeah, I'm not passing it over yet. Cool. All right, so number 10, investing in equitable social services through revenue reform. A number of these things we've brought about or talked about, including childcare. So many of the childcare providers are communities of color. They are not paid the way in which they should be. They do so much hard work, unfortunately have been disproportionately impacted by the COVID-19 pandemic. And so we are seeking to support our childcare industry in whatever way possible, whether that be the folks that are the childcare providers or those that are in need of childcare. It's been really interesting to see some of the research that has come out over this last year about the way in which the job industry has been affected because more folks, women in particular, have been at home taking care of children. We know that childcare costs have over the last few years continued to increase and are not as accessible to folks as we'd like it to be. So House Bills 2503 and SB 239 houses employment-related daycare with other childcare and early learning programs. It caps ERDC copays at 7% of a family's income. I will tell you that as someone that works in my other job as a case manager with families that access ERDC, this is fantastic work, particularly in capping those copays. These bills also seek to expand access to all children, regardless of documentation status, and it provides stability for providers by enrollment, not attendance-based payments. So some great work happening in the legislature. Would encourage you to support it in whatever way possible. I know many of you already are. House Bill 2505 promotes equitable child welfare services by establishing the Child Welfare Equity Advisory Committee and directing it to advise the Foster Care Advisory Commission and the Department of Human Services. Great work being done within our child welfare system. Then we've got the kicker reform to earned income tax credit, HJR 10. Uses excess revenues from personal income tax to increase allowance of earned income tax credits. This one is in revenue. We are actively working on this one, talking with Chair Nathanson about the path forward for this bill. It is critical for so many of our folks who file with ITIN numbers. I know that there are a couple of different things addressing the earned income tax credits, including HJR 10. And then we've got the disconnection from CARES Act tax breaks. House Bill 2839 disconnects certain corporate tax deductions from CARES Act tax breaks. This is one that has seen lots of we've heard from both sides on this one. It was a really interesting discussion, and I know they talked about it. I want to say in the one of the special sessions as well. Again, we want to make sure that we are seeking the best way in the state to create revenue so that we can invest in critical services, again, like childcare, like education, like housing and home ownership. So many of these things, and I think, you know, this session, at this point in time in the session, we're having conversations we didn't envision we were going to be having about a year ago, where we are going to be seeing a significant amount of federal money, where we're talking about big things and not necessarily coming from a place of austerity where we expected we were going to be at. But we want to make sure that this continues on, this biennium, next biennium, the biennium that follows that. And so to do that, we need to look at where we can benefit our communities while creating revenue. Next slide, please. So thank you so much to all of you for tuning in, for hearing us out today, for asking us to present. It is, we are filled with gratitude to have this opportunity to share what our priorities look like, and all of the hard work that so many of our members are doing. So thank you so much. Really appreciate your time.
Well, if I might, the thanks goes in both directions. Thank you, Rep. Campos, as well as Mr. Khan, for being here and bringing these ideas and this legislation to life for us. We know that it's important for voices to be heard, but also that voices can be put into action. And I know today is a huge day for you on the floor. Let me turn it over to my colleagues and see if they have any questions or remarks, compliments, comments. Commissioners? Go ahead, Commissioner Treese.
Thank you so much, Rep. Campos and Mr. Khan. It was really a great presentation and very comprehensive. It provided me the opportunity to look at the whole package. A couple comments, one on slide 5 about healthcare. You know, I think one of the important pieces there is that our BIPOC community needs to see themselves reflected in the providers. And I know that that's the purpose. I just wanted to reinforce that those barriers are so critical to remove. The same thing would be true in our education system, you know, at a number of different places. But again, I thank you for the presentation. And I also want to thank Commissioner Fye for bringing this forward, for Jajit to provide us with this, because this is frankly, I'm aware of the caucus. I've looked at what the agendas have been, but this was really comprehensive. So thank you.
Other commissioners? Commissioner Fye, go ahead.
Thank you, Chair. I echo what Commissioner Treese. Thank you so much for being here. Representative Campos, you're my rep. I'm in your district and excited of all the work you're doing. And thank you, Zakir, for being here. And please extend our gratitude to Representative Bynum We really appreciate all the work you're doing, and especially as a county that's the #1 diverse county in Oregon. We really appreciate all the great work for you doing, not only for our community, for everyone in Oregon to really prosper and make sure Oregon is an inclusive state for everyone. You know, Commissioner Treese, thank you for the thanking me, but I think the thanks and the gratitude goes to Jagjit for organizing this and really coming up and making sure that we hear what our state legislators are working on and how we can better align and support the issues that are so relevant to our constituents here. So thank you, Jagjit, for your great work, and look forward to hearing more about what the caucuses are doing. And yeah.
Any other commissioners? Well, I'll just close by saying that as we in Washington County redouble our efforts to operationalize racial equity in all of the suite of policy and program investments that we make in serving the community, I can really identify with these 10 different categories or priority sets as you discussed them. Because I see that each of these 10 highlighted areas apply to the work that we do here at the county level to ensure that we are serving the needs of our diverse community. So thank you for your leadership and ensuring that we are moving forward together as a whole state, and that as you said earlier, Rep. Campos, that everyone has the opportunity to thrive and has access. So onward ho we go together. Thanks again for your time.
Thank you all so much. Take care.
Thank you.
Take care. All right. Well, thank you, commissioners. We will move on then to our next topic. We're just about 10 minutes ahead of schedule. It looks like we do have our team members here for the next topic, which is the Planning Commission appointment discussion. I'll turn it over to Mr. Roberts. Thank you.
Director of Land Transportation. Planning work group. He's going to run through just a brief staff report, and then we'll look for some feedback from the commission on these two Planning Commission appointments. Go ahead, Todd.
Thank you, Mr. Roberts, and good morning, Chair Harrington and commissioners. I'm Todd Borkowitz, Associate Planner in Community Planning, and we are here today to present candidates for consideration for two Planning Commission appointments. The first is representing District 1, a position held by Ian Beatty until this past January. The new appointee will be eligible to serve 2 4-year terms. The second is representing District 4. It's a midterm vacancy that's effective immediately due to the resignation of Eric Erstad. And these appointments expire, or that appointment would expire on January 31st, 2022, but the appointee will be eligible to serve 2 additional 4-year terms after that. There are 11 active applications, including 3 applicants from District 1 and 2 applicants from District 4. We also wanted to highlight that we received an application from Patrick Rubella, who is listed on the agenda but has since withdrew from consideration. Staff reviewed applicant materials and conducted phone interviews with each candidate. The agenda contains information about each candidate and a memo outlining the rules regarding geographic distribution of members. When we're happy to go through each of those or answer any board questions. Today, we ask that the board review and consider the Planning Commission candidates for District 1 and District 4, provide direction to staff on these appointments, and if you are ready to move forward with these appointments, authorize an action for the April 27th board meeting to select and appoint candidates. And with that, we're happy to answer any questions that you have. Thank you.
Can I just ask a question on attachment A under member description? while not required by the Community Development Code, CDC, or Planning Commission Rules of Procedure, generally 2 members are nominated by each district commissioner and 1 by the board chair as an at-large appointment. I hadn't noticed it put that way before. So we use some different phraseology in different places, like in our rules of procedure and whatnot. So I just wanted to call that out to everyone's attention, that's all.
Yeah, and I would just say, Chair, I think that that's been a matter of practice amongst the board members. So again, not an explicit requirement in the rules of procedure or the community development code, just a matter of practice.
Okay, thank you. So we have a seat available from District 1 as well as District 4. And it looks like there are 2 available candidates from District 4, if I heard you correctly.
That is correct.
And 3 from District 1, and then multiple volunteers from the other 2 districts.
That is correct, 11 total.
What are the wishes of commissioners? Questions, comments?
Chair, I was hoping to follow actually Jerry's lead on this, but Jerry's muted, so I'll just take a stab and say for District 1, I'd like to move forward for Michael to be on that seat.
And just to clarify, that's candidate Michael No, NGO.
Yes. Michael NGO, yes. Todd.
Yeah, and I apologize, Commissioner. I'm kind of scrambling a little bit because the candidate that I had selected is the one that dropped out, Pat Rebellia. I've known Pat a long time, and I was really hoping he would do that, but I did have a conversation with him, and he expressed some concerns about him being able to meet the meeting and probably the investment of personal time criteria into this. So he opted out. That came just a day or so ago, and I really have not had an opportunity to go back and look at the other 2. And so if I could, do just one thing, and then maybe could I, Chair, if I could have conversation with you a little bit, if I could take a little bit of time, maybe over lunch, and then come back after lunch and make a recommendation, could I do that?
Well, the action isn't slated until April 27th, which is 2 Tuesdays away. So I think we can touch base on this at our next meeting on the 20th as well.
Would that work for Stephen Roberts? Is that okay, Stephen?
Yeah, we can do that. We'll have submitted the board packet materials ahead of time, but as long as we know going into the meeting, if you're confident that you have a selection ready to go, then we can adapt.
We have a board packet update on Friday as well, so
that's right.
I'm pretty comfortable that we can flex just fine.
Yeah, I'm planning on Stephen. I'm planning on having it to you by tomorrow. Okay. I just need to go back and review a little bit, maybe have another conversation with you quickly. And if you have some time later today, after the work session's over, then let's talk. Okay.
Okay.
All right. Thank you.
All right.
Great. Any other board comments or questions?
I just would like to say thank you for the map with the locations, and that's really helpful. I haven't seen it presented that way, so I appreciate it. So thank you.
Yeah, we thought that would be a useful tool. Mm-hmm. Great. All right. Well, thank you.
Thank you. Thank you. All righty then. We will move on then to the next topic House Bill 2001, Middle Housing Economic Analysis and Market Feasibility Study. Watch out, team. The chair read the document.
Excellent. So I'm going to actually turn things over to Teresa Cherniak and Kim Armstrong are going to run through the presentation. Oh, go ahead.
Am I the only one where Stephen's audio is cutting in and out? No, I'm not the only one. Okay.
So Teresa, do you want to go ahead? I apologize. I'm having some
Sure.
technical difficulties.
Sure. Yeah. Thank you. So as you have heard a couple times now, we've given briefings on what was in House Bill 2001 and the start of the work that we're doing. We did receive a technical assistance grant from the state, DLCD, Department of Land Conservation and Development. And the grant was to look at the economic and market feasibility of middle housing in the county specifically. And so Kim is the project manager, Kim Armstrong. And we did hire Eco Northwest to work with us on that. So Kim is going to give the intro to the work, a little refresher on the House bill, and then she'll introduce Eco Northwest, and then I'll kind of wrap it up with talking about getting the board's input and the next steps. So go ahead, Kim.
Hi, I'm Kim Armstrong. I'm a senior planner with community planning at Washington County, and I'm joined today by Becky Hewitt and Tyler Bump at Eco Northwest. And if you could go to the next slide, that would be great. Thank you. So I will give you a brief overview and a refresher of how House Bill 2001 impacts Washington County, and then Becky and Tyler will talk about the results of their assessment. Then Teresa will talk about strategies and next steps. Next slide, please. And then the next slide. Thanks. So in general, middle housing is a building that includes more than one dwelling unit that is typically sized approximately in between a single detached dwelling and an apartment building. This can include plexes, townhomes, and cottage clusters. ADUs are typically sort of included in the middle housing universe, broadly speaking, but ADUs are not included in the House Bill 2001 requirements specifically. Next slide, please. In general, House Bill 2001 requires jurisdictions, including Washington County, to allow duplexes on each lot or parcel inside the urban growth boundary that we allow a detached dwelling, and that we allow all middle housing types in areas inside the UGB that we allow detached dwellings. We can exclude future development land, and we can regulate middle housing to comply with statewide goals, including some of the significant natural resources that we just spent a bunch of time paying attention to. Next slide, please. Next slide, please. Thank you. We may, of course, continue to allow detached single dwellings. We can regulate siting and design of middle housing within the guidelines established by LCDC during rulemaking. We can allow middle housing in additional locations, and we can incentivize. We can always go beyond minimum requirements. We simply must not discourage middle housing, which generally speaking means that we can't add additional burdens and complexity to middle housing development that we do not also apply to detached single dwellings. Next slide, please. So for the highlights of minimum compliance, we have to allow a duplex on any lot that would allow a detached dwelling. For other types of middle housing, we may choose to require a minimum lot size. We don't have to. If we choose to require minimum lot sizes, we can require a minimum lot size of no more than 5,000 square feet for triplexes, no more than 7,000 square feet for fourplexes, and no more than 7,000 square feet for cottage clusters. We have to allow townhomes at about 4 times the underlying density And the rules establish that we may require no more than one off-street parking space per unit. Again, this is sort of the floor of the requirements that we can have. And these are established in the rules that have been adopted by LCDC. Next slide, please. So now we're going to talk about this project. So Eco Northwest was hired to do this feasibility assessment for us. And the idea is that the data and the information that we get from this technical assistance project will feed into our development of code concepts and policy decisions that we're going to be doing next. And then once we've gotten guidance from you all on the general shape of policy decisions, then we can move on to code writing and adoption and be all done on before June 30th, 2022. So now Becky and Tyler are going to talk about the results of the assessment. So you can go probably 2 slides. And Becky, thanks so much.
There we go. Thank you, Kim. Can everyone hear me okay? Thumbs up. All right, great. So Kim gave a quick intro to us. My name is Tyler Bump. I'm a project director, also a director of planning and development in our urban systems team here at Eco Northwest. I'm joined by my colleague, Becky Hewitt, who will present some of our more detailed findings later on in the presentation. Overall, I do want to sort of highlight that this has been a super fascinating project for us to work on for a couple reasons. One is working with your talented staff has been super great on this project. And 2, the diversity of places within Washington County and how we're thinking about HB 2001 has been quite the nut to think about cracking as part of this work. Today, I'm going to give an overview about what we looked at, how we looked at and how we evaluated things, go over some key sort of high-level findings for the county as a whole, or the urban unincorporated areas of the county as a whole. And then Becky's going to dive into some details, and we'll talk about potential strategies at the end. So the overview of what we did, the focus of our work is really focused on a few key questions. What makes middle housing more or less economically feasible to build? Where in unincorporated Washington County might middle housing be more or less economically feasible to develop? So spatial component across different parts of the unincorporated county. And how could available county policy choices affect middle housing feasibility? So depending on where
So is it just me or did our speaker
No.
freeze?
He's frozen, unfortunately.
Yes.
Oh. Hi, Becky. Are you still there?
I am still here. If he doesn't come back unfrozen in a moment, I can pick up where he left off. Let's see what's happened.
Tyler, are you with us?
I am here. It looks like I'm back.
There you go. Okay,
I
good.
froze for a moment.
So as much as I like to see your face, I'm just going to assume that there are some internet challenges. So if it would help, do feel comfortable to just turn your video off. And so that'll increase the likelihood of your audio stream coming through.
Okay, there we go. Did I make it through this slide before I cut out? No, okay.
No, it ended right where you had complimented, you talked about how it was an interesting study working with super talented Washington County staff and quite a diversity of spaces in Washington County to evaluate. And so you were at question 2 on the slide.
All right. So I will just go through, I gave an overview of what we're going to talk about, but I'll just jump into it at this point.
Great.
So the focus of our work on this project is looking at evaluating what makes middle housing more or less economically feasible to build. Where in unincorporated Washington County might middle housing be more or less economically feasible to develop? So the spatial component to different areas of Washington County. And how could available county policy choices affect housing feasibility? So a little bit of consideration on strategies to move the needle one way or the other, depending on what the county would like to see. Next slide, please. All right, so our areas of focus, the areas that we looked at, our analysis was limited to the urban unincorporated area that is identified in the map here. We looked at lower density residential designations, and this analysis excludes most undeveloped parts of North Bethany as well. Next slide, please. So looking at middle housing feasibility, our analysis identifies what could feasibly happen with HB 2001 under current market conditions, not what will happen. So we're sort of looking at the overall market capacity, as we call it, but property owners make different decisions for different reasons all of the time. So this is an overall capacity look, and that different property owners make different decisions for different reasons. It's also a point in time. So we're looking at this under current market conditions. Things can and will change into the future, but given the best information that we have, this is what we're looking at today. The other thing is we're focusing on new development and redevelopment, and not evaluating conversion of existing buildings to middle housing types. And we're also not looking at situations where you might have an existing structure where you might build additional middle housing around or on the same site as that existing structure. So we're really focused on new development and redevelopment at a sort of parcel scale. This analysis also accounts for current land use designations and limitations based on water-related resources generally, but does not account for all site-specific conditions. So we're trying to get a sense of environmental constraints, water-related resources as best as we can without site-specific information here. Next slide, please. So some of our findings overall, or observations across the area that we're looking at, middle housing is feasible throughout the urban unincorporated area, but on a relatively small fraction of parcels. So we're looking at about little less than 3% of all parcels in these lower density residential zones where middle housing is feasible today. And that varies pretty substantially by sub area. So anywhere between 0.5% and 7% of parcels by sub area are possible or feasible for middle housing development. The interesting thing is the 3%, while it's a pretty small number, is also about double the amount of parcels that are developable or redevelopable from a feasibility perspective with single family housing today, as currently allowed under the existing code. Redevelopment potential is mostly limited to larger lots. An average home in a developed subdivision is not likely to redevelop with middle housing. So what we found is that vacant lots and large lots with lower value homes, manufactured homes or accessory structures are the most likely to be feasible for middle housing development throughout the unincorporated county. And that lots under 7,000 square feet are a little more challenged from a feasibility perspective. And so we're really looking at these larger lots, both in a redevelopment and a new development scenario across the county. And that ownership housing, mostly townhomes, is more likely than rentals for new middle housing, given market conditions across Washington County today. Next slide, please. So some other additional considerations: the pace of middle housing development in developed areas will be gradual over time. We mentioned earlier that redevelopment and sort of infill conversion is more likely when a property owner sells to a new owner. So an existing homeowner lists their house, that house goes to market, somebody buys it, that new buyer will decide what to do with the property. And in some situations, it's easier to remodel an existing home rather than redevelop or convert it to middle housing. And so this is something that happens in the market today, where we see rehab and renovations of lower cost single family housing. That will continue to be a thing, and is a lower barrier for a lot more actors in the development and investment space than middle housing development. Even where middle housing appears more financially feasible than single family dwellings may still get built instead of middle housing. And there's a couple different reasons for that. One is developer experience. Middle housing at the scale and in this context is pretty new, broadly distributed across our communities. And so developers, it will take a little bit of time for developers, investors, and banks to really understand what that means from a business perspective, as well as from a demand perspective. And on the demand side, there's different housing type preferences throughout the region. So folks have potential homeowners, potential renters have different preferences for different housing types, and that single family demand will still exist. Although what we'll see later on is that middle housing can help support more attainable or accessible housing for different folks at lower price levels as well. Next slide, please. And I am going to pass it over to Becky to start digging into the details here.
Thanks, Tyler. So yeah, I'm Becky Hewitt. I'm a project manager at Echo Northwest. And I'm going to talk a little bit more about how what we saw varies through some of the different areas that Tyler mentioned and kind of what's driving those differences. And then also take a look at some of the implications of our results and from an equity and infrastructure perspective. So we kind of, the areas that we used, they're based on census geographies. They don't exactly match up to your community plan areas, but there's some overlap. So bear with me if not all of these names are familiar to everyone. Hopefully you can at least pick them out on the map of where we're talking about. But up in the northern piece, so Bethany, Cedar Mill, and West Haven, Sylvan area, where it's labeled as A on the map. This area has a fair number of vacant and very large lots, including the Bonnie Slope area, but also kind of all along the fringe there, where there's a fair amount of development potential already today. We didn't include all of the vacant lots in North Bethany, but there is some, there was some of North Bethany that we included where there's potential for single family housing today and could be potential for middle housing in the future. There's also a very strong ownership market in this area, a lot of demand for ownership housing. So those two things together means that there's a lot of potential for new townhomes and new single family homes. Overall, we were looking at between 3 and 7% of the parcels that were included in our analysis were identified as potentially feasible for middle housing, compared to about 2 to 6% that might be feasible for new single family housing. And this is also an area where new middle housing can help on the affordability side, or at least on somewhat lower cost ownership opportunities, because townhomes are roughly equally feasible as high-end single family housing because of their higher density. So it's creating opportunities for more homes at a somewhat lower price point without kind of compromising the overall feasibility. Then in the area shown as B, kind of north central piece, Rock Creek, Oak Hills, Cedar Hills, and this little area we're called Marlene Village. There's very little development potential in that area. It was less than 1% of lots across most of those areas because those are almost entirely developed with single family subdivisions, lots under 10,000 square feet. As Tyler mentioned, we saw very few lots under that 7,000, 10,000 square foot threshold where there was redevelopment potential. And because that's most of what you see in these areas is just subdivisions with houses on them, there was not a whole lot left that might have redevelopment potential or infill potential here. The price of the new middle housing was not expected to be high enough to trigger redevelopment in most of these situations. Then the area identified as C here, so Aloha, this little area right next to Aloha that got called Other Aloha. And this area, Heritage Baseline area where there's a manufactured home community. There's a fairly strong demand for lower cost and moderately priced for sale homes and relatively strong rental market in these areas today. And there are also a relatively large number of larger developed parcels that are over about 15,000 square feet that could have some redevelopment potential. Even so, we're talking about a small percentage of the parcels in this area. One thing that we noted is that the Heritage Baseline area, our analysis flagged some of manufactured homes on individual lots and also an existing manufactured home park there as potentially being financially feasible for redevelopment. I do want to note So that could be a concern because of the potential for loss of unsubsidized affordable housing there, but we also, our analysis does not fully account for all of the process and cost that would go into closing a manufactured home community. So it's an area to pay attention to, but may or may not actually be financially feasible. And then we also know that the county's community development and land use and transportation departments are collaborating on some work on existing manufactured housing park in the county, and a later stage of that work is going to start looking at strategies related to preservation. So there's already some existing work that will pick up on some of those potential concerns. You can go to the next slide, please. So in these areas, looking kind of further south, the area identified as D, where it's kind of Raleigh Hills, West Slope. There are some larger lots in this area. It's a sort of a mix of subdivisions with, kind of average value homes or above average value homes on them, and then some larger lots. Overall, we saw about 2 to 3% of the lots that were in our analysis here potentially feasible for middle housing. And that's kind of an overall mix of what might be feasible there. That's kind of similar to what we saw across the county overall. Then in Garden Home and Metzger, the areas then in the little E circle, it was about 3 to 4% of lots, or a decent number of lots that are between 15,000 square feet and an acre. So in that range, that could potentially be large enough to make sense for redevelopment. And there's fairly strong demand for moderately priced for sale homes and also some rental housing demand. So a range of housing types, still townhomes came out as kind of the most feasible thing most of the time. But this is an area where you could see some potential redevelopment with middle housing in theory. And then in Southwest, looking at the Northridge Woods area, south of Aloha, and then in Bull Mountain. Again, we saw about 3 to 4% of lots. There are a lot of very large lots in this area. It's not all fully subdivided out. Some of those large lots do have natural resource constraints on them that, again, are partly accounted for, but the specifics may vary on individual sites. And because some of them are very, very large, the actual, the specifics of how much is constrained probably matter there. But these areas, again, we thought might have potential for townhomes because they're large enough that if you could do a development, you could potentially do a fair number of townhomes across some of these larger sites. Next slide, please. So thinking about what the implications of this are from an equity perspective, there's a couple of different angles that we looked at. Overall, implementing House Bill 2001 helps make existing neighborhoods less exclusionary, less restrictive of smaller and attached housing types that tend to be lower cost. That's one of the main issues that House Bill 2001 was intended to address. And our analysis shows that that can happen in many of these areas, most of these areas. And then allowing more housing, and in particular, the kind of smaller and lower cost housing types to be built in, especially in desirable locations that don't have a lot of land left, that can help keep existing housing more affordable over time by providing an opportunity for that demand to be absorbed rather than just bidding up the cost of existing homes. And also, middle housing tends to be less expensive than larger detached homes, and I'm going to show the range of that next. But that also is an important consideration here. We did look at the potential for displacement and increasing the risk for existing renters. So the way we looked at this was for developed properties that might have redevelopment potential. We in particular focused on single family rentals. A homeowner generally is going to get to make some choices about what they do with their property, and they're also generally going to get some upside from the sale of their property if development potential has increased. And so the real concern on a displacement front is to renters. And so what we did is looked at, out of the potentially redevelopable properties in these areas, how many of them are potentially rental housing. We looked at that based on whether the owner address matches the site address. So do we think that the owner lives on site? Couldn't tell in every case, but just using the best available information, trying to flag where we think there might be existing renter occupied housing. And we compared how many of those properties that are the possible single family rentals today might be redevelopable with middle housing compared to how many might be redevelopable just single family today, where you could potentially either do a one-to-one replacement or tear down an existing home and build multiple existing new single family homes. So kind of looking at what is the net increase in risk to existing rental homes. What we found is that it's less than 100 additional rental homes that could be potentially redevelopable due to the implementation of House Bill 2001. So that net increase in redevelopable single family rental properties was under 100 homes. And that about a third of those were those manufactured homes on individual lots. And so addressing some of those may be protected by some of the existing restrictions around closing and redeveloping manufactured home communities. And to the extent they're not, addressing that issue would protect roughly a third of this set of households that would potentially be at greater risk of displacement. Next slide, please. So this chart shows the range of estimated sales prices for new single family and middle housing in urban unincorporated Washington County. For some of the housing types that we found to be feasible around the county. So you can see an upper and a lower bound for some of these different types. So we're comparing single family on a medium-sized lot, single family on a small lot, townhomes, plexes, and cottage clusters. And so what we're looking at is we looked at market data to estimate what do we think what would you be able to sell these for in the market? And then we looked at, okay, which of these things are feasible? Assuming you can sell it for that much, is it feasible to build it? And so this is showing the range of what was feasible in the market and feasible from the development perspective. So single family shown in the yellow there, we're estimating a range for new construction single family homes between about $390 on the low end for that's for a small lot single family detached home in some of the lower priced areas in the county, up to $700,000 and clearly above if you're get into custom homes and things like that. But even just for a pretty standard 4-bed house on a pretty standard lot, up to about $700,000 in some of the higher priced parts of the county. And then by contrast, middle housing, we're looking at more in the $220,000 to $460,000 range, depending on kind of the finish level and the size of the unit and things like that. But so you can tell that although there's some overlap there, on the whole, middle housing is offering feasible development opportunities at a lower price point than you would get for new single family detached. And the next slide, please. So from an infrastructure perspective, this is mostly based on staff's conversations with service providers. So staff talked with Tualatin Valley Water District. We provided opportunities for comments for these service providers, so Clean Water Services and county transportation staff as well. They reviewed the report. No one had immediate concerns about those findings. There were a couple things that they flagged for kind of further consideration. local streets, that the potential for increasing development on local streets that might not be up to current standards, and that might could potentially exacerbate some of those issues. And then more so looking at how is this going to play out over time? What might the pace of development be? How quickly is it going to come? Which areas might it come to first? That's where Clean Water Services and Water District wanted to just kind of continue to sort of track and monitor and see if they might need to shift the timing of improvements or things like that in order to respond. And with that, I think I'm going to hand it over to Teresa to talk about some of the strategies that we identified in collaboration with staff that that the county might want to consider in looking forward to implementation.
Great. So if we could go to the next slide. So the report identified some preliminary strategies. These are things that the board may or may not have enough information at this point really to give us any guidance on. So there are things that over time we'll be looking at more and bringing back as we get further for possible policy decisions. But we wanted to give the board a chance at this point to weigh in case there is something that you wanted us particularly to look at, or that you thought this is really great, or no, we don't want to do this, just so we might have some guidance to move forward. So we know based on what we've looked at with the rules and with our regulations that we do need to change our code standards to comply with the rules. So we'll need to look at the housing types we allow, lot size, density, that sort of thing. We do right now have some restrictions on land division in the R5 district. So that's our lowest density residential district. It's 4 to 5 units per acre. And we require a pretty large lot size to do any land division, which would restrict the ability to do townhouses. And so that is probably something that we, under the rules, will need to change, but we're looking at that. And then one of the things that comes up quite a bit is the ability to require sidewalks and curbs and gutters and maybe half street improvements. So all of that is what's under frontage improvements. And we have some limitations under the new bill in what we can require of the middle housing. So we aren't supposed to go beyond what we require for a single family. And in a lot of cases, if you're building a single family, a detached dwelling on a lot of record, we don't require any additional frontage improvements. And the board has heard about this quite a bit with the sidewalk gap issue. So this is something that we did look at, and the costs do make a difference in feasibility, but it's also something that's important for communities to see those improvements done. So that's something that we'll be looking at through the code development. And so those are things we know we need to look at. There may be other strategies depending on whether the board would like to see the feasibility of middle housing increased, and or if you'd like to see us maybe go beyond what we are required to do, and maybe to encourage or incentivize housing. These kinds of things could make a difference in terms of either community acceptability. For instance, the basic design requirements could help the middle housing be more accepted in communities. And then things like parking reductions, certain kinds of parking reductions from the already reduced limit of 1 space per unit. We could go beyond that. That could help with feasibility. And density bonus is also possible, either to get more affordability or maybe specifically for regulated affordable units. So all of these things are possible depending on what we might be wanting to achieve. And again, if we could get input now, that'd be great. If not, we'll be bringing this back a little bit later too. Next slide. And then there is a requirement in the bill itself that every jurisdiction considers strategies to increase affordability of middle housing, and they specifically lay these things out. So property tax exemptions, waivers of system development charges, and sorry, we didn't spell these out, transportation development tax and system development charges. So looking at waivers or reductions of those are charges that are made on new developments. And then possibly a construction excise tax to fund affordable housing. The study does look at these, but it, I think, primarily recommends that we think about these not only about middle housing, but about housing and housing affordability more generally and more broadly. So that's also something, if you have input on now, that'd be great. If not, we'll be bringing it back. So next slide. So now's the time that with all of that, I know that was a lot of information, and it was a big report. So I know, Chair, you said that you had the opportunity to look through it. Hopefully people did have that chance, but this overview that we presented here hopefully gives you enough to be able to maybe ask us any questions that didn't make sense or that you'd like more information about, particularly if you have questions about the geographic variations. So maybe I'll just lay those out first and then we can go to the other ones.
So commissioners, what questions do you have for staff? Or if you have feedback, dive right in. Go ahead, Commissioner Willie.
Thank you. I'm going to, I have to run down and pick up a package here. So I wanted to get my questions in here a little bit earlier. This is a great report. I have not read the full one, but your information here followed along. So I was following along in the report with that. When you talk about parking reductions in those particular areas, generally, does that only work if they're close to public transit, so they don't have to be close to max? But certainly there has to be a fairly good bus line in there, or reduction of parking spots really don't work. And so that's my first question. And then you talked about the reduction of TDT and SDCs, but somebody has to pay for any infrastructure design. So who's going to do that? Is that going to be on our tab?
Great questions. The first question about the parking reductions. Yeah, the idea would be close to transit. And right now we do have reductions if you're within, I think, a quarter mile of transit. And I wish I knew the number of feet off the top of my head, but that's usually like a 10-minute walk. And so we probably would relook at that and whether that's still the right amount of distance or if it might be something else. And then as far as reductions to TDT or SDC, that's exactly the conundrum. I think that you might reduce it to incentivize something, but someone else then has to pay that bill. And so that's why we're suggesting we need to look at it at a broader level based on all different types of units that might be in the queue to get a reduction. One of the things that a lot of jurisdictions are looking at, and we've been requested to look at, is maybe basing some of those on the size of unit and sort of scaling it. So there may be, rather than complete waivers, maybe there are different ways to calculate it. and then you spread it across the same pool, but in a different kind of way.
I'd like to add that the TDT and SDC reduction, we need to consider those things.
Right.
So what I think we think is we will provide you information on different ways to do it and hope you have a robust dialogue about whether you want to do something. But if you conclude you don't want to do something, I believe that that fulfills the condition of considering it.
Other commissioners?
I'll jump in. Couple of three real quick, though not easy questions. One, in regard to, and it's a legal question, so it'll have to be dealt with at some point. I suspect the state didn't provide any indemnity for the suits that are going to occur for neighborhoods who are going to be impacted, and whatever way that may be, it might be that they have amenities such as trees that'll be having to be taken down, and maybe that their whatever their view might be will be compromised, or they just don't like it. And I know those are going to happen, but at some point I'd like to know what if any, and I doubt any indemnity they're going to give to counties who implement procedures. Regarding topography.
Can we pause just there for a second? Alan?
Sure.
Is someone from your team involved on this project?
Not that I know of. I think
Okay.
Jackie's been following it, but I don't think she's been intimately involved. I talked to her about it yesterday.
Okay, well, I just want to make sure that Commissioner Rogers' question gets followed up.
Okay, we can certainly do that.
The team and the legal team. That's all. That's why I interrupted Commissioner Rogers.
Thank you, and thank you, Alan. That as you know, anybody can sue anybody for anything, and the suits fly when people think that they're being impacted either by parking requirements or just that they don't like the development. So it'd be interesting to know. In topography, Teresa, you didn't mention this one, but I'll just pick on where I live. People are always complaining downhill about water runoff, and that wasn't one of the things you talked about, but I can't change the science of Earth, and water runs downhill. And so if you put more structures on hilly areas, which are great to put on because you have slopes and you have views, you have all kinds of things, I think we're going to have a bit of a topography issue. So you might want to take a look. You were mentioning Bull Mountain. There's a lot of Bull Mountain that have slope issues. So I don't know what that all means in terms of permitting, not permitting these sites. And the last thing that I would say, which is not a question, is that Jerry was absolutely correct in his comment about additional taxes and fees. It's ironic that we're trying to provide additional housing by taxing somebody else. And it's a difficult quandary. And my political statement is I just heard another business client of mine today moving out of the county, attempting to move out. I hear 1 to 2 every week. We're looking at other alternatives where taxing structures are different. That doesn't mean it's bad or good. I'm not making an assumption about that. But I think we got to be very careful on the amount of compiling or compounding that we're doing with fees and taxes. It's going to be a problem whether we want to admit it or not. It's happening. We don't want to see flights like we've seen in New York and California and elsewhere where you have wealth distribution that moves just simply for reasons of fees and taxes. So that's my 2 cents on those issues, and I'm done.
And as far as topography, I believe there's some provisions. There are some provisions in the rules about that, and also about significant natural resource areas, which includes a lot of the sloped areas and the areas that lead into our waterways and wetlands and all of that. And so we'll be looking at that as part of the regulations and seeing what kind of limits or assurances we can work in to address those.
Commissioner Treese. We're enjoying your kitty behind you, by the way, or at least I am. Thank you for your coworker.
I think she's found some sunlight there. A couple of questions. First of all, great presentation, really thorough. It looked like that section A was pretty much District 2. So that's not lost on me. And I would like to understand more, and this can be offline, Teresa. I'd be happy to, spend some time talking about the intersection between the affordable housing bond and this work, just so that it's clear in my mind. And I also want to understand what the development community is thinking when they look at this in terms of quote feasibility, and also what the community response might be in some situations, positive and negative. So those are my questions.
And I wonder if either Becky or Tyler might talk a little bit about the interviews so we did involve the Home Builders Association and a couple actual builders, both for-profit and nonprofit, in reviewing the early work on this. And so I don't know, Becky or Tyler, do you want to talk at all about those discussions?
Sure, I can start, and Tyler, if you want to add on, feel free. So yeah, we spoke with a representative of the home builders and an experienced middle housing developer who's mostly worked in Portland, but a little bit around the suburbs as well. So they helped kind of inform, making sure we were making reasonable assumptions about market costs and things like that, so that our analysis would kind of generally reflect the costs and market conditions that they experience. In terms of their interest, I think there are some folks who have a lot of experience in this and kind of know how to make it work. I think it's a relatively small percentage of the development community right now, and Tyler mentioned sort of developer experience as one of the things that is going to take a little bit of time for folks to kind of get comfortable with it and figure out how to come up with a workable business model and where to get financing and things like that. So we did hear a little bit of like, there might be some new folks who try to get into the game. It may not go perfectly as first for them, that we might have some folks who are sort of making a first move into this space. And that I think that's sort of an opportunity as well as a challenge, that to the extent that you want to support more local developers getting into this, there's maybe room to offer technical assistance and kind of help people figure it out. I think some of your bigger home builder types, they at least know how to do townhomes. So they might, for them, I think it's more of a scale question of can they work at a smaller scale, or can they find bigger sites that work for them? But I think it'll be a little bit of a mix depending on kind of what the business models look like today and kind of how easy it is for them to pivot to take advantage of this opportunity.
And then as far as community response, this is so we've just completed the draft report, and this is the first kind of public discussion of it. We will be talking about it with the Planning Commission next week, and it's now available. The report is now available, and so we'll make it available on our website. And as far as our outreach and education on the bill and the implications of the bill, we'll be working it into that, but that's just starting.
Commissioner Fye, your district has some coverage in this study as well. Any questions or thoughts at this point?
I have a lot of questions, but I'm with Commissioner Willie. I was trying to juggle the reviewing the reports going along with the presentation. So, but one of the easiest quick questions, you talked about conversion not being included in the feasibility, and and that's just, you're talking about just this report, right?
Right. So conversion will likely happen, and it's allowed under the bill. And we actually are quite limited in what we can require of conversions. So we can't put additional design requirements or anything like that on them. So they will happen, but I think for the purposes of this study, there wasn't the factors that could influence conversion are so widely varied depending on people's individual circumstances that there wasn't really a way to factor it into this study. And so that's why it's not included. And Becky, I don't know if there's anything more about conversions you would want to say.
Just that it is, as Teresa mentioned, it will be allowed with House Bill 2001. There are other obstacles for people trying to convert a single family home to, a triplex or fourplex in particular. The legislation tried to address some of those obstacles and created a little more flexibility to make it possible, but there are still a lot of challenges. So duplex conversion, I think, maybe a little bit of a lower barrier situation, but getting to a triplex or fourplex triggers some building code issues that, even though there's flexibility to deal with them now, they're still there. So I think those are things that might limit the practical opportunities for conversion, even if the legal opportunities are there.
Okay. I think I'll read the report and I'll send my questions, because some of the things that was coming up as you all were presenting this report or this presentation was, this seems like an opportunity to also address some of our, land use or some of our codes, how they've been problematic to certain communities and actually perpetuated a lot of disparities and excluded a lot of people from the process of home ownership and participating in this opportunity. So those are some of the questions that were coming out. So maybe I'll read the report and see if there is an opportunity to address some of our land use historically, how we can address at the same time, maybe facilitate equitable process in this. And so, yeah, those I'm not really, I'm trying to pinpoint, but there's a lot that came up with this presentation. So I'll touch base if it's okay with Stephen, send my questions his way and we can go from there.
Great.
I think our staff will take the feedback however they can get it from us. No worries. And better sooner than later down in the process where they've written an ordinance and we say, nah. Any other commissioner comments or questions before I go forward? Okay. Thank you very much for this information. It's there's a lot of analysis in here, and I really appreciated the inclusion of maps and charts and tables. There's only one part where I really felt like for our community members, it could be a tiny bit approachable, more approachable. And that is, you're all great community planners and you know the vocabulary like nobody's business. But talking about frontage, so I kept noticing frontage, 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 and I thought, I wonder if my understanding of frontage meets theirs. So I went back to search frontage, and you don't get a decent enough description until page 45. So I would suggest you move that forward because frontage is really important. Those sidewalks, those curbs, and to the point, just to bring it forward a little bit more, slide 19, I really want to thank all of the staff who participated and raised the points that are listed on slide 19. That if we don't build to current standards, it could, actually will, exacerbate, pretty much I can guarantee it will exacerbate problems and play out over time. You know, commissioners long before me have dealt with gaps in sidewalks. And as you mentioned, the prior commission has dealt with that. So I really appreciate that this has been summarized so that we keep this in mind. Let's not kick the can down the road. There is no more road to kick it down to. And I also appreciated the clarity that you put in on slide 20 and 21, both. Sidewalk gaps are an issue now, no matter what the housing types are. And I would like us to have a goal of creating no more gaps, right? Mind the gap. Let's address those gaps. Let's not continue to build on the generous supply of gaps. Let's drive it in the other direction. And I know programs like Minor Betterment really work on that. So, but let's prevent gaps. Slide 21, you highlighted the waivers, and this is where and SDCs, I stand with my colleagues, Commissioner Willie and Commissioner Rogers, that, you know, we have county-wide revenues, and to provide waivers in a portion of the county in urban unincorporated areas really does mean that we're using county-wide dollars to deal with very district-specific areas. That it really brings up the question of fairness. So I appreciate, particularly Mr. Beck, that you've made sure I understand that we have to consider these things and that it is very important that we have a robust discussion ahead. As tiring as it might be, we do need to go through that process because if our decision is no, and I don't know that it will be, but if it is, we need to make sure that we have demonstrated that we have considered the upside and the downside. So thanks for that. I do have a couple of questions, but I think for the sake of time, that I'll follow the lead of my commissioners, my colleagues, and hang on to those. But there is one that I think might be useful now. And it's in the realm of design guidelines, design standards. Could you summarize for me to what extent we have design standards now for urban unincorporated areas?
So this is one of those topics that we'll have a lot more in a little while on this. So we have a staff person working on it, and particularly looking at infill development and the design standards. So we do have some limited design requirements on single family. We do in some of the districts, for instance, transit-oriented districts, there are a lot of design requirements, mostly about how they face the street and how they interact with the street, and a little bit with how they interact with each other. But right now we don't have significant design standards in place. The bill provides for certain kinds of design standards that are more about the street facing aspects. And it lays out the things like where the garage can be and how much window coverage there needs to be facing the street and where the entrances can be, that sort of thing. And right now we, except again, probably for the transit-oriented districts, we don't have standards like that.
And I don't know that that's a bad thing, is my point. I don't know that we want to regulate good design. You know, I have appreciated, I'm in my fourth home of ownership, 3 of them here in Oregon. And I appreciate the effort that the builders have taken to ensure that the windows of my homes, which have gotten on progressively smaller lots, don't look directly into a window of my neighbor. But I was struck by when I ran for my first term as an elected official, that the lobbyist from the Portland metro area realtors took me aside and said, "How can you stand to live in your neighborhood?" That bluntly. And I looked at her and I said, "Well, what do you mean?" And she said, "Well, your homes are so close to one another." I had moved to a infill neighborhood and the homes had 6-foot lot lines. So there was 12 feet between the 2 homes. And I looked at her, I said, "Well, all of my neighbors in the 22 homes in our little infill neighborhood happen to like our homes. That's why we decided to purchase them, right? There are other places we could have purchased." She said, "Yeah, but your lots are so small." I said, "But that's what I wanted." And so that experience has always stayed with me, that isn't it nice that we have an ever increasing diversity of styles in various locations here throughout the cities and the urban unincorporated areas of Washington County, as well as those in the rural areas. You know, I continue to see them, particularly as I bicycle in the rural areas, seeing more and more homes allowed by the land use. So I think we have a lot of good protections in place, but I think that we need to walk softly, or at least as one member of 5, I will continue to want to walk softly in these different options that you bring forward to us as we move forward.
You know, I might just talk briefly about design and the history of us. Except for the transit-oriented districts and North Bethany, we've shied away. And a lot of that has to do with this thing that we've talked a lot about of being a county as opposed to a city, that getting into design historically has been looked at more as something that a city does than the county. So I think it will come up as part of this discussion, especially if, you know, certain landowners see, oh, I thought a single family house is going in there and now maybe a quad's going in. How is it going to be designed differently? So I think it's something we really have to talk about, but historically we haven't done that.
Yeah. And I think that the building and development market has gotten a lot more savvy as well. And so they're very sensitive to marketability and offering good design up front without it being required. And I want to recognize that as well. Yes, people can be fearful, but I think they're seeing a lot more good design throughout communities, including in urban unincorporated Washington County, then they're seeing what they might think as detrimental or bad. So, but thank you very much for that comment, Mr. Back. Those are my comments for today. Are there any last commissioner questions or comments that you wanted to raise for our staff?
And one other thing that we might just ask, are there other things, and whether you can answer it now or as you are able to look at the report in more detail, are there other things that you would want us to look at or research? We have a limited amount of time and a limited budget available, but part of coming to the board was to be able to identify further things that maybe we hadn't thought of, or that in particular you were interested in that we might explore further, including any of the strategies for increasing affordability, or I'm sorry, increasing feasibility, which could also be affordability.
Teresa, this is Roy again. I know in Tigard here, there was some problem in the commercial area with height restrictions that prohibited growth upward. And to me, that's the answer to a lot of issues, is to go upward. As people age, they don't necessarily have to have big lots. They like lots of green space around their big abode, but that might be a 8-story building that has, 1,000 to 2,000 square feet on one level with elevator. So we might all share the same place, in other words. Do we have anything other than middle housing that would allow us to deal with height restrictions in certain areas? I understand nobody wants a 6-story building next to their small house that, be shade all the time. I understand all that. But are there other options that we could explore in terms of in the right places to have height restrictions removed so that you could develop more housing that was affordable with a small footprint, so you don't have to have a big lot, but would provide housing options as well? So I just throw out that, and other areas that have looked at that said, well, that makes sense. Let's see what we can do in the right places, the right time. So are you looking at that at all in the middle housing arena, or is it just side by side single family accommodations?
In most of the districts where we allow single family right now, except for the higher density ones, most of them are at 35 feet height. But some of the higher, so our 24 and our 25 plus may be up to 65 feet in some cases. I think what we found in the unincorporated urban area so far, and this will change over time probably, is that we haven't been seeing development going up to our height limits at this point. Even where we really want the taller structures to go and more units and such, we haven't been seeing that. So over time it may become more of an issue, but I think we haven't seen it yet here. I don't know if anyone else, Andy or others, want to say anything on that.
I was just going to add that
I was just going to say thank you for that information. Talking with home builders, they said the same thing. There's not a market. I won't be probably living long enough to see it, but I failed to see how people who have what I call shotgun houses, where you park on the first floor, you walk up to the second floor and have maybe your kitchen and some living area, and you walk up to the third floor is where you actually have your bedrooms. Let them turn 55 plus and see if that's a pleasant sort of a living situation. So I predict that over time, all these new housing units are going to be reconverted, changed in some capacity, because we're blessed with a young county, but it's aging, and those young folks will also age if they choose to stay in the area. So anyway, just a thought.
You just described my neighborhood, where there's a lot of us that are 55 or older, but I probably won't live here when I'm 80 years old. So point taken.
And I was just going to add too, I think generally middle housing generally needs to comply with the underlying rules in the single family district in which you would build it. So if there's a 35-foot height limit, that allows a 3-story house. We do see a few of those constructed, but not a lot currently. So you could already do 3 stories even in our most restrictive zoning districts. And then, as Teresa said, in some of the other higher density districts, the height allowance may also go up as well. But it's an interesting point.
And we will be back in June with the final report for this. So we will be back to do a presentation at the June 15th work session. And then the acknowledgement of the final report is scheduled for the June 22nd agenda on the consent agenda, because our contract with DLCD does require that we have a board acknowledgement, which is an acknowledgement, not a specific acceptance of anything particular. So we will be back. You'll have another chance to talk to us about this.
Yeah, and then as we noted, thanks, Kim, all of the findings will inform our development of code standards. And so in future meetings, even after June, we'll be filling in more about this, but using this kind of as a basis for a lot. And we'll take your comments however and whenever you can give us.
So after that June 15th final report and the June 22nd acknowledgement, will you be coming back to us sometime in the summer to ask for further direction before you do that, the final code?
Yeah, so our hope is that every 2 months, we can come back to the board in work session with an aspect of the work that we want to let you know about and to have you weigh in on. So the idea would be so June, I don't know if that's 2 months from now, but so that one, and then July, August. So at least by August, we would come back with where we are at that point and the policy kind of decisions that are coming up, and probably at that point talk more about our outreach and how we'll do that. And then another couple months after that. So we want to make sure that the board is kind of well immersed in this as we go along, and that we're getting your feedback, because it is quite big, and we want to make sure we don't end up at the end with proposing something that you haven't had input on.
Thank you. There's a big noisy truck parked underneath my office window, so sorry. But I am able to hear everything you said. Are there any other commissioner questions or comments at this point? Otherwise, I think we're done with this topic. Thank you, team.
Great. Thank you so much.
Back here in June, and then again August or so.
Great.
And we'll
Thank
get
you.
you our feedback. All righty. So at this juncture, thank you, Tyler and Becky as well. We've all learned things from your good work. So after our lunch break, we will reconvene at 1:15, and that will be in an executive session. Okay, and that will be the last item on our agenda for today. Should I take a motion now to enter into executive session, so that we've already done that motion in open session, and then we just pick back up at 1:15 in that executive session?
That'd be a good idea.
Okay, so at this point, I'd like to entertain a motion pursuant to ORS 192.660 sub 2 sub I.
So moved.
Commissioner Treese moved, Commissioner Rogers seconded. All those in favor, please vote by saying aye or raise your hand. Everyone's raised their hand. Thank you. So we'll see everyone on the executive session meeting link at 1:15. Thank you.
Thank you, commissioners.